Hello, good morning. Morning. Good to see you. Thank you.
Good morning, my fellow warriors. Good morning, fellow Rotarians. Good morning, everybody. My district governor. Good morning, sir. Our National Vice Chairman, PolioPlus. Good morning. Our representative from UNICEF. Good morning. On behalf of the District PolioPlus Committee Chairman and all Rotarians of Ojo District 9111, we hereby call on their district governor to please call this gathering to your language.
My fellow Rotarians, let me say good morning to you all. I especially recognize leaders that are here from NPPC, and of course, the representative of UNICEF, and my fellow, my United presidents that are here. Yes. My United presidents that are here, and polio chairs and fellow Rotarians. I hereby call this polio seminar to order. May I please request you to all stand up as we take the Rotary grace. After the count of 3, 1, 2, 3.
Already steady, go.
By installation, inshallah, remember, even the low one in the UK.
Yeah, so having officially started the program, I still have to go back again to the district PolioPlus committee chairman, which is past assistant governor, Solar Surgery. So please give us the opening remarks.
Thank you. My United District Governor, I recognize the NNPPC Vice Chairman, sir, my PDG, Adeomi. Good morning, sir, and thanks for being part of this event. And of course, the representative from UNICEF, you are recognized, the Rotarian President, the chairman of the polio clubs, the polio chair, fellow Rotarians and guests. Good morning. Yeah. I welcome you to our polio seminar. As Rotarian, we are united in our mission to eradicate polio and improve global health. With your passion and expertise, we have made significant progress, creating a lasting impact. Let's continue working tirelessly towards the global goal and supporting the polio fund. Today, we will receive updates on our efforts and learn about the importance of ODK. Let's sit back, learn and grow together. And today also, did you decorate the PolioPlus Society member who have fulfilled their obligation for this Rotary year 2023, 2024, 2025, 2026. And the new member will be presented with the certificates. And also to remind you all, World Polio Day is coming up October 25th. And by the special grace of God, we shall be celebrating as October 25th. In our own unique way. And we shall very soon update you on the detail of the event. And also, I would like to remind you, during the World Polio programs, either at the basic level or at your club, let's try as much as possible to see that we register that event. Because if you don't register events, it sounds as if you are not part of the event, not just only the chairman, nor the president. Let everybody that's taking part in that event to register is ourselves. So that counts for us and also counts for our district, count for your club, count for our district. Thank you. And after the meeting, I would also like to appreciate just maybe 5 of us that were here very early. I have a little gift for you. Please wait till after the event. I will surely let you have the event, your gift. Thank you and God bless.
Thank you, District PolioPlus Committee Chairman. So next on the agenda is the brief remarks from our district governor. Sir.
Thank you very much. Just before that, I would like our general sales to please introduce yourself. Please kindly take the mic. I want to know the Rotary Club's representatives that are here. Thank you.
Yeah.
Please just your name and club. Your position and
My name is Carol Baji from RC Okota Foundation.
My name is Rotarato Enoa Abdurazak, RAC Ajara, Chief of Staff to the DRR.
Bisika, the Rotary Club of Akomajo, the Rotary Foundation Chair.
I am Roger Ako Alagbe Michael, United President, Sugar Club of Ijaniki Central.
I'm Dr. Zainab Balaji, President, Sugar Club of Maryland.
I'm Ruta Halilu, always the district representative.
Yeah.
Yes, please. Let's welcome and invite the disabled district representatives. And also, let's welcome National Chairman, Nigerian National PolioPlus Seminar, PPT, Azan.
Rotary Club of Golden, we care environment.
Rotary Club of Omole Golden, Polio Warriors.
Cecily AKF, Ambrose Illuvadio, Chairperson of Polio.
Ask President, where is it? From Rotary Club of West Africa.
Rotarian, Rotary Club of Ethiopia, United President. Rotarian, happy birthday, Polio Chair, Testac Central.
Rotary Shima just finished from Rotary Club of Tax Central, Club Admin.
And Mrs. Oluwole, Rotarian Oluwole, Autojanity Central. Thank you.
Good morning, all. My name is Loretta Omaru, Rotary Club of Okota, Polio member.
Good morning, everyone. I'm Rotarian Kingsley Chijoke, Rotary Club of Okota, the United President.
Good morning, Rotarian Marie Awu, Ikeja member.
Good morning, all. My Yano Gusaya Vitose, United President, Akowajo Metropolitan.
Polio Share.
Good morning, everyone. My name is Rotarian Fra Ikwewa, Rotary Club of Oregon, Club Polio Committee Chair.
Good morning. My name is Rotarian Daniel Solomon. I'm the CP Cosmopolitan.
I'm Rotarian Bolatito Olaboye from Rotary Club of Ikeja South. I'm the foundation chair.
Rotarian Otumba Emeka Wilson Metos from RCC Adeleke Jones, immediate past president.
Wale Adelifuja, PolioPlus Rotary Club. Rotarian Ibrahim, PolioPlus Chairman. Rotarian Madrostin, Polio Share from RCC.
Good morning, sir. I'm Rotarian Jima Taufik, Foundation Chair, RC Baja Leodom.
Kalejaya Adedamola, United President, RC Autojaniki Central.
United President.
My name is Pastor Seth, Regional Pathway, District Operat Polio.
Rotary Tony Aguda from Polio.
Good morning, everyone. My name is Rotarian Saleh, Rotary Club Public.
My name is President
Rotary Club of Total Prestige.
Rotarian Olufunke Fagunwa, Rotary Club, Ewututu Prestige.
Good morning, all. I'm Rotarian Femi Jayizumi, Rotary Club of Ikeja, Treasurer.
Good morning, all. My name is Rotarian Temitope from Rotary Club of the One Estate. So, welcome everybody to this August occasion, August training in the month of August.
Let me especially recognize the chairman of Nigeria National PolioPlus Committee, Chairman Joshua Hazard, and of course the Vice Chair, PDG, Yomi. I recognize. So thank you very much. My district Rotary representative, the representative of UNICEF, Tesla, thank you for coming, and of course my district Polio Chair, Past Assistant Governor Busola Satri, my United Presidents that are seated here, Assistant Governors that are here, fellow Rotarians, guests and friends. I am honored to welcome you to our polio seminar. Today we gather to reaffirm our commitment to eradicating polio, a disease that has plagued humanity for far too long, and the top priority program of our organizations. Firstly, I would like to acknowledge the remarkable progress we have made in polio eradication efforts as a district. Our district has been instrumental in supporting immunization campaigns, advocacy, and community engagement. I am sincerely proud of our Rotarians' dedication and perseverance over the years. Despite significant progress we have made in Nigeria to keep polio at zero, challenges still persist. We must remain vigilant and committed to our mission as Rotarians. To move forward in our district, we are going to focus. One, we will engage our community and strengthen partnerships with local leaders, healthcare workers, and community influencers. This will continue to unveil on the strategies to engage on these stakeholders. Two, we must intensify more efforts in our advocacy for polio immunizations and support for affected communities. And thirdly, we shall engage more Rotarians to be more involved in monitoring our immunizers during the NIDs. All these three key things that I mentioned are areas of focus this Rotary year. I sincerely want to appreciate the continuous effort of our Interstate Nigeria National PolioPlus Committee and NPPC. I want to reassure you, sirs, that District 9111 will work closely with you to achieve our set goals for the year. And we also relate closely with club presidents and polio chairs to ensure effective implementation of polio activities for the year. My fellow Rotarians, let's intensify our efforts, leveraging our collective strength. Together, we'll make a difference and bring us closer to a polio-free world. I am confident that with the collective effort, we will eradicate polio sooner than thought. Now, I would like to emphasize the importance of donating to polio fund. Our district has set a modest goal of $150,000 as our contributions to polio funds this total year. We have been creatively generating funds using the teddy bears. I guess some of you must have seen the teddy bears, most especially the clubs I have visited. And then we have one here. We have for all the clubs, and of course for so many of our activities. So, and I'm excited to announce, thank you today for that, so that everybody will see. Somebody will have to go with this today, you know. I am excited to announce that the highest donor will win the mother of these teddy bears at the end of the lottery year. I hope you will be the winner. I thought that the polio child will come with the mother teddy bear. It's as big as this. And I hope the highest donor to our fund, to our polio fund will go with that beautiful souvenir for the year, maybe at our conference. May I remind you, my dear fellow Rotarians, that every $1,000 donated can immunize 1,666 children against polio. 60 cents is the cost to immunize a child. I therefore enjoin you to please donate to this fund, no matter how little this Rotary year. I also must especially thank the winners of this study. We have visited almost about 12 clubs of ball, and in each of the clubs, we've had this being presented to the highest donor for that particular fellowship. The last fellowship we had, the highest donor made a donation of $500 to the Rotary Family, to the polio fund. So let me also quickly remind you that we have several ways to contribute to this polio fund. We can all be members of Polio Society. So it means that contributing $100 to Rotary, to polio fund every year. And I have some forms here with me. The district polio chair will share this with us. For some of us who wants to make this commitment here today, that every year I will make a minimum contribution of $100 to Rotary Foundation. For those who have been members, I have your LAPEP here, the district personalized PolioPlus Society members pin. I have it here. I will shortly decorate you with that before you leave. And of course, I have certificates for those who are joining afresh, for those who have paid this year and have also pledged to become a member of that society. I also want to remind us of our $10 contribution from each Rotarian. And I want to please encourage us. We have all promised that nobody in our district will not give at least $10 to Rotary, to Polio Fund this Rotary year. So I want to join all of you, my United President that are here, and of course Polio shares that are here, to please make sure that no one is left out without making these contributions to Polio Fund. I have given quite a number of ideas on how to generate this. You can start with it's just about 16,000 naira for the whole year. So at every fellowship, you should endeavor to move around and collect the little you can from Rotarians until you are able to remit a sum of $10 for each and every one of us. I must also quickly recognize clubs that have added this sum to the annual due, and I want to enjoin you to please continue to remit this sum to the polio account as people pay their annual dues. I would also like to seek your support in terms of donation of pluses. This Rotary year, we are going, all of us will be part of the immunization process. And thank you very much for bringing out the mother teddy. I can see it's staring at us. So, like I was saying, I also want to join us to please support in terms of donation of losses. We'll be going out for immunizations, and we know we need to go out with some items to encourage our mothers to encourage community leaders to bring out their children for immunizations. So at district level, we are going to call on us to please, at any time, please bring to the district anything we think we can used for these losses. Maybe a bag of noodles, that's candies, balloons, and all the rest. We need all these things to entice those children and to give us seamless means to immunize them. So no club will be left out, and we're going to do this through the schools as well. So these items is to encourage our mothers and community leaders to bring their children for immunization. I encourage you to please see to our call when we make requests for these items. In conclusion, let's work together to make a difference. Donate to the polio fund today and help us to reach our goal. Together, we can eradicate polio and create a healthier future for all. I thank you, and let's make it happen. I'm confident that together we can achieve great things and make lasting impact. Let's please all go to work and continue to unite for good. It is my prayer that the Lord will reward our service to humanity. I thank you very much for the return. Yes, just before I take my seat, please quickly, my permissions are my chair. So please quickly decorate
approve the outline business case.
PolioPlus Society of and this is a very unique bill. Please encourage you to please attach this, to your lapels to signify that you have paid such contributions and that you are a member of this PolioPlus Society. So, just before that, if you are here, please kindly come forward for your certificate. Willow Michael Leto. Please first please come and receive this on this behalf. Thank you very much. Please can we put our hands together for these are the people that have just pledged this country here to become a member of the Polio Society, PolioPlus Society. So I thank you very much. Kazeem Adenikenyaniat. Ade Mowore Adetola Jacob. Ayingo Chidiebere Joseph. Thank you. Martin Sosina Shinana. Awola Jabiri Olaiton. Adewobi Bola. Please can we put our hands together for the government? This is a commitment, and we need to appreciate them. Thank you very much, guys. Morgan Virginia Inyangwe. Thank you. I will also give you that of the ability to give outside the place. Thank you very much. Gabriel Okolio, please also take this. Which I mean, please also take this on behalf of. Those are the members of First Act, and we put our house together for very late.
Okay, live. For more details. Alive.
I will pass it to Kuti. Can you please put your house together for them? So this will you. If you are the rector bar that is lodging of our home, I will be David. I will call the last name, so I won't let it.
Okay, see you. I'm with you,
Rotary and I will be David. We put our hands together for the president of our home. Thank you for this compliment. Please, can you pronounce this last name? I hate my LFA. Thank you. Rotary since Metro Sebeka, please, can you please come forward? Can we put our hands together for? Thank you. Please, may I also request my chair to please bring out the forms if you are here and you want to make a commitment to say, I want to belong to this society and through my contributions of $100 every Rotary year. You understand? Please kindly indicate if a form will be given to you for you to fill. And I think $100 every year is not too much for you to belong to that prestigious society. May I now please call Rotary Motura, you are delaying. Now we put our hands together for these people. These are the people that are now members of the society, and they have constantly been given a minimum of $100 to this polio fund. Rotary Kazim Adelike Daniat. Rotary and Rotary Metro Sebeka, please now go forward for. You know, we put your. Rotary David, how will this come? May I also announce to you that whatever you give will go to your own, will be added to your contributions to the foundation. And this can also lead to becoming a Polaris Fellow when you give a cumulative sum of $1,000 US. So it is not just for polio and will not be recognized for it. It's beyond here. And when you check your farm on my Rotary, when you look at it, it will be automatically written there as a member of the society. So I think it's something you should please join. Rotary and it was a visit. Okay, Rotary Niwa, Osage, Rotary Mma Collins, Rotary Morgan, Virginia, Rotary Gabriel Oyema, and Rotary Owino Michael. Please, can we put our hands together to this? Yeah. Thank you very much. Now we put our hands together for president. And I must commend Rotary Vincent, is the chairman of that club that has been doing so, wonderfully well with as regards the contributions to polio in the Rotary Club of Festac. May I please call the Rotary Benedict to Kumande of Rotary Club of Gowon Estate, Rotary and Diocese, please. You please come forward for your La Pepe decoration. And may I also call Rotary and they will be born live here. And Rotary Razak Sadawa. Rotarian Babatunde Salah. You want to collect for? Okay. You did, yeah. I could decorate you. I'm going to give you also a second. Make that one free. Rotarian Awura Daderi Olaiton. Rotarian Ezekiel Didi. Olaiton. Rotarian Ezekiel Didi. Rotarian Martins Osina Shinana. Rotarian Irene Evelyn. Irene. Okay.
Just maintain the side.
Rotarians, Ayi Gochidebere Joseph. Okay. Rotarians are three of us. Can we put our hands together forward? Rotarian Jones Adewale Aderonke, can we put our hands together? Okota is also doing so. I still find that for Lashani from Momole Goldie. I did more warrior and the Tola Jacob from which number for him. Okay, please can we put our hands together for please before we leave, if you make your commitment, you will get your certificates and of course also will be decorated at subsequent events. I thank you very much. Please can we put our hands together for all this? So fellow Rotarians, I thank you. Please let us all be patient. Please can we move forward? The seminar will start now. Now we please move forward and let us be patient so that we can understand very well how about this priority of Rotary programs. Thank you very much. I thank you very much for listening to me and thank you very much.
Want to invite the music for his presentation, and I want to use this opportunity to inform moving the directors also. Please, anytime a donation is made, you have to come to your district PolioPlus office and your district PolioPlus representative, and then you will be donations for the district office. You have to put the account details on where the money will go and how the cumulative is. If you can show $100, the charge. If you cannot do $100 at a time, you have to take $1. Like some of your accounts, they picked up the $10 a month thing. So you always do probably by the end of before going to the conference, you will have done your $100 and you might be created like this with conference. So thanks so much for that. And that's on the agenda now. We will go into the business of the day. And like it's been said, where there is no law, there is no offense. So please, in front of the state, Mr. Chairman, please give us a grand roll and the seminar is ready.
Yeah, thank you. So, Chairman President, my district governor, the district Rotarian. Yeah, our expectation at this seminar today, as you can see, we have our leaders here, we have a representative from WHO here, and of course from UNICEF. They're going to talk to us. We're going to have the updates on our journey so far, and also the advocacy, communication, and social mobilization in polio eradication, to give us the update on it, and the important step of conducting successful polio supervision. They're going to tell us much of that, and of course, ODK, which is very important, how to use the ODK. I believe that we all have our handheld phone here. They're going to put us through so we understand all this data. But lastly, I would like to inform us that we should please put our phone on vibration. We don't want our phone to ring out at all. If your phone rings out, let's say visit you and we chip in something for polio, and that is the reason why we did that box there. If you hear you discussing or you can call, we just tap you in a friendly manner to just chip in something for polio. I believe everything goes to polio pause. Thank you very much. Let's continue to join the fight of polio eradication against polio.
Thank you, my district polio of future. Next on the agenda is the NNPC chairman's presentation. So, my chairman, sir.
You carry motor come out. I beg they go use that motor go carry children around 12:30. You did that morning when I did tell the other guy saying go help me.
Good morning, DG Henry. Say pleasure and thank you for suspending some of your club rules to make sure that you honor us. We don't take that for granted. Yeah. And would you like to give him a hand of applause, please? I mean, if nothing else, he is the latest regional polio warrior for Rotary International. Please give him another round of applause. It's a big deal. So, good morning, everybody. Now, what happened? Are you sure the morning was good? If everybody says good morning, but nobody actually tells me how good the morning was. First of all, I wasn't very sure of my breakfast. I missed it because I went late to the dining room, but I was able to get something. But it's good morning to me because when I see these smiling faces and the only golden queens, I came to block me in my office and I provided bread. And I mean, I've seen presidents, secretaries, yeah, it is a good content. So thank you so much. So it's my pleasure to be at the Rotary Center today. First, let us know that. Next slide, please. Okay. I put this purposely just to remind us that we have a problem in our hand. And the problem is that a lot of Rotarians don't seem to realize that polio eradication is Rotary's #1 global project. Until we get that done, we are not going anywhere. And we made a promise to the children of the world that we'll get rid of it. So let's
can we all be seated? Sorry, sir. Please, can we all be seated? And let us please move forward. Please let us move forward, please. Please, if you are sitting at the back, please, I beg you, please just move closer. Thank you.
So if we're doing anything, let us know that it is a project. And whatever you give, the $1, the $10, the $100, the $10,000 and everything goes for that because it's a major, it is higher than any global project you can think about. And it is so because if you look at the next slide, some Rotarians are looking at this as if it is no more. Some never experienced the polio. Most of us here have never even seen a polio stricken, especially from the youth. And some say we have so many cases we should leave it. And some say it isn't exciting. What is in this polio about? But let's know that it is our promise. And we must try to do it. In the next slide, we tell you that we are not done yet. To end polio is a task that must be done. We must copy from the world is from the world. Now, since the achievement in the next slide, since the achievement of the World Polio Free Declaration in 2020, Nigeria has been immense in sporadic outbreaks of various poliomyelitis. In spite of all the efforts, the millions of vaccine doses were given out. The millions of naira were spent. The deployment of all the money spent, the issue persists. However, the world has now set the deadline for December 2025 for Nigeria to allow the transmission of polio. In the next slide, we see the officially reported the wild polio virus and the vaccine-derived polio virus. We get this data from WHO every week. And as you can see, as of 5th August, which is last week, the total wild polio cases in 2024 is 99, but as of today, we're getting 20, which is compared to 23 for the same period. And you may say that we're winning, but we need to get this done. The one that is worrying us here is the circulating vaccine-derived poliovirus, or simply called the variant. The total variant virus in 2024 last year was 383. But as of last week, we have only 100. You can say we're getting progress, but it doesn't work that way because the season that we get these viruses spreading faster and everywhere is during the rainy season, of course, for various reasons. In the next slide, you will see the tell you the new wild virus incidents reported this week. We give you all these figures so that you can imagine the issue we have at hand. One area place was reported, environmental is for others one. Now, when the virus is found in the environment, it can be coated, it's much more dangerous because that means there is a carrier somewhere in the vicinity or there is a case pending. And so we take it as serious development. But in the new cases, the isolates for the vaccine derived, we have 2 cases, and you won't believe it. The 2 cases found worldwide last week. One is in Nigeria and one is in China, which is our neighbor. And we are the one exporting all these things to our neighbor. The environmental was 14. In the next slide, it tells you how these new cases have been found, so that the WHO and they are tracking this very well. Afghanistan, that is where we got 4 positive cases. Pakistan, 1 AFP case. Now, an environmental case is something a human being. It is when you go into the scientific area and take sample. But the AFP case, that means a human being and health. As you can see, Chad has 1 variant case, and Nigeria has. The other are positive cases from Germany and Israel. And what tells you that even our countries that are far and wide, they are not free from it. And the end of the story we say, wherever there is a case, no child is safe. The next slide will try to tell you what happened in Nigeria. The case in the previous week came from Sokoto, Zamfara, and Katsina. But after case actually came from Sokoto again. So the total number of cases we have in Nigeria, Oyo, with which state and for, but just know that they are all located 90% of them in the northwest region, that is in the state of Sokoto, Kebbi, Zamfara, Katsina, and the rest of them. We call it the AIT state. That is the access of information of the cases. But you see, we have 22 now. Last year, 2024, we have 98. Again, you may say that 6 months through, maybe if you double it to 44, it doesn't work that way. There may be new cases that come, but if you do our homework, you may discover that it will stay there. Now, we talk about all this data. What is polio? Now, it is dangerous because polio is caused by from person to person. It doesn't come from the air. Central thing, it is preventable, but once you get it, it's incurable. Now, it's found mostly on children under 5, and in most areas where there is no routine immunization taking place, and where the hygienic situation is very bad, but it doesn't mean that it doesn't happen in GIA, it does. But just to know that there is no cure for it, I have a certain. So the polio eradication strategy, if you know, there are 2 goals. The first goal is to interrupt transmission for all polio variants in Afghanistan and Pakistan. Goal number 2 is to stop the transmission of the virus and prevent outbreaks. We have been shifting the goalposts to these goals. We're supposed to be ending this year. They shifted it to 2026. Now we are hoping that by 2029, we shall get it down. Don't forget that you need 3 years of no virus at all before they can declare the whole world free. Just to remind you what is our role. Fundraising and unpacking, okay, advocacy and awareness. So let's remember this our goals. We are staff. In fact, we are the founding partner of the Global Polio Eradication Initiative. UNICEF, WHO, everyone has assigned roles, but our own role is fundraising, and you know we do it very good. The other point is advocacy, because we are non-political, we are in the country. UNICEF goes, in fact, when you go out with UNICEF and WHO, they have a limit because they are international and they have so many protocols. They can't stay the way it is. And there must be permission. And she can't just enter in a vehicle or get you. There are protocols for their traveling. We don't have because we are the locals. So to do advocacy to the village chiefs and the other people. But we're supposed to raise awareness. Because one of the key things we brought into the global polio education is that Rotary is found everywhere in the world. And this country has volunteers of Rotarians in almost all the states. And especially Lagos. You may like to know that 75% of Rotarians in the country are found in the south. From here to Port Harcourt and the rest of them. The only way in the north that you find a lot of Rotarians is inside Abuja City. Now inside Abuja City, 3/4 of the Rotarians come from the south. Now from the north, so I know what I'm talking about. So you are very crucial into this business. So let's start talking about fundraising. We have to raise the minimum of 50 million. If we get the 50 million, we are willing to get to give us 100 million. So our budget of supporting UNICEF, supporting WHO, supporting Nigerian PolioPlus committees and India and Co is 150 million. If you fall short of $1 for the 50 million, we don't get 100 million. You see where we are pleading with you and pressurizing you to make sure that we get it. Now we have another thing that is going on that people don't like. If you all presidents and AGs, if you check their portal and the presidential citation, there is a column there that they insist and they're lobbying every club to raise a minimum of $1,500 every year. It can be one person, it can be cumulative. We have not succeeded in that most of the time. And I have to plead with Henry here to make sure that he sign on not less than 20% of his DDA to PolioPlus. So the 1,500 is very good. And I'd like to thank Jim for bringing it here. So 1st July, the first place to go was to raise funds with the TDP and for PolioPlus. I like the issue of the $10 per person. And of all, let us find it, that's why I came late. I was trying to check the latest figures on their district portal. Can you give a round of applause to Omono Golden? I checked them. Omono Golden, 30 people have already given that minimum $10. Yeah, no, that's right. Yeah, I said that. Don't argue with me. I get laptop and a remote phone. And I have a witness here. I was trying to encourage this young man that they use all their money for party. They show that only 3 Rotary clubs have given anything to PolioPlus. I was in 9141. 35 clubs have given to PolioPlus fund, Rotary Club. What I'm telling you is what has entered the portal as of this morning. Some of you, like the DG said, and the money is hanging in somebody's pocket, it's hanging in treasurer's money. It's hanging. If you don't fill that form and send the money, you are given. And that is why what the DG said, check your profile and make sure that the money you have given is reflected within 2 weeks. In fact, we had a quarrel with Musala, they didn't want to tell the DG. I told him, told her to take it that. They sent us pictures and announced that they have raised money, nobody gold, wherever it is you went. 3 weeks later, I have not seen the money reflected. Up to yesterday, a grammar. So this money is very, very important. It also encourages membership or encourages membership. Somebody who gave money and discovered that the money didn't go because the money got hung out with the treasurer and it was not given this that program. So please, let's watch it. But again, congratulations. It looks as if 9111 is doing very well with the issue of the PolioPlus Society membership. I have my receipt when we finish because it needs to give me one of those things where I like that. So congratulations and thank you, DG. It's a way to go. But the district PolioPlus chair, with you secretary have to follow it up. It's not easy. The DG can do it alone. The man is running between pillar and post. He wants to visit 2 class. He wants to have lunch. He wants to do this. If he gets not less than 10 to 20 emails a day, I'm believing you, I don't get it. Sometimes they forget to reply and send another. So please, let's take this PolioPlus Society. Another way is that when you get a goal, it will reflect in the club presidential citation. It's automatic. But you see, if you don't do it, you have a problem. You don't have. Now let's go to the data. Know where you belong. To associate what they did in the foundation, what they did total cash, and only 6 clubs in the last Rotary year. Lagos, I don't even add the home. Lagos, only 6 clubs were able to raise $1,500. I think it is, and the one I don't like is what the DG is pushing on, that every person should pay not less than $10. 27 clubs in this district last Rotary year didn't give shish PolioPlus. That means if there's an AG there, district committee member, district committee chair, the president elect, the treasurer, all these big grammar, those 27 clubs don't give shit with due respect to, I think, being a Rotary Club, I think Lagos is not acceptable. So this year, I'm expecting that you will be the seminar 1413. Now let's do a comparison analysis in the next slide. You gave 50,000 cash contribution last year. I have recorded district governor who has said that your minimum limit to give to PolioPlus fund is $150,000. Am I right, DG? Your goal for PolioPlus, you say $150,000, right? Over to you. So we are not going to get this 50 as happened last year. But you're already starting in the poor north. I'm a technician and we use part of mathematics. So far, as of yesterday night, in your portal, only 6,604 has been recorded. Now you have done 2 months and you raised 6,000. That means you multiply it by 6. If you get the same thing every 2 months, you are going to end up with 36. That is below this. So this is just data. So the earlier you do it, the better. And I'd like to thank this. So far, 58 clubs have not contributed anything to the Rotary Foundation, especially PolioPlus. 58 clubs. And July and August is the month that everybody wants to welcome the DG to their club. Those of you that the DG hasn't visited, don't allow him to open his computer and say that it is 0. Abi? So you have 58, you just get pins for the club, for those who are PolioPlus Society Club. I'd like to tell you that at least 22 people have already recorded having paid. You know, you can join the society and pay later in the year, but 22 have already been paid. If you go to the next page, you'll see the people that have paid. Abekuta, Motorayo, that's the popular name that always paid. Agora going to pay. And then John Wilson Mentus, Okonjo, David, Fetak Town. And just typical of what they are saying here, so many people have registered. 5 of them, David Joe Sunday, have paid, and 1 of them is sitting down here. But yesterday, 1 person has paid. Ikeja Central, Willa Deomi, and Yola have paid. Ikeja DRA, Mary, Awolaja has paid. RC Ikeja, Lufone Adebayo, Isolo, Olo one day, Awolaja, K is the K in Lagos West. And Maryland, Ikeja, Sulafosi, Ayokonle, Ojodu, Martin Sosinachi, Okota, Irene, and you go, Chidebere. Wow. I didn't know this girl's name is Abigail. Oluboshola Abigail Sachi. She the one? Round of applause. That is leadership by example. Okay? Now you have work to do. Before the DG leaves here, she will give you an equivalent of $100. Go and process it in his name. When they are making presentation like this, you leave first. Okay? Thank you for embarrassing you. Now, let's talk about the other role, advocacy. Ask our IT to send us the picture that when the Rotary leaders visited Lake Buhari, they visited Tinubu, we visited the vice president, we visited them. Even if you didn't get it from me. And that goes for all of you. When they give you assignment, keep records. That is what this laptop will do. One for something And I'm on behalf of the DG. As the DG, what of you we give you? So we high and mighty. The one that I'd like to talk about is what the Usala was talking about, the world. It is a great day. It is all over the world. 9-1-11, they said it, and 9-1-12. You are really disappointed. This is the star for the West African region. Lagos, there are no worry where you say you don't look at it like. They are always saying, but I don't know what has happened here of late. So much expectancy is coming from you for World Polio Day, but you do activities or you don't do. Those of you do that, you must register it. Just take your account, say, click on that and say, I'm wearing my t-shirt to work today. That is an event. I'm going to pray today for polio victims. That is an event. I am visiting the primary health care to see what is it. That is event. I'm taking the walk. That is event. I lift my hair and call it World Polio Day. That is event. I eat food and say, this food costs 5,000. But today I only eat meat. This mama here. No more fish. You will save 2,000. That is an event. So many events that we do, but we do not record it. So I think we do that. Of course, we are holding a nation week in April, which will be coming next April. Next slide. That is when we say that you can actually do a lot of things yourself. Any creation that you want to do, and you can do that. So register your event at mpolio.org. Start planning now. Don't wait for it. Whether you are walking to Ojukute or the island or the display, or you are going to get a machine to ride, or you are going to get Alibaba to walk just 2 kilometers on the high density road or whatever. Anything can happen. It doesn't have to be on the same day. So we are waiting for you. Just to take of the example, next slide. See what happened. Last year, December, the top district by number of class 911, 9111, or 9111, 911 alone is a vehicle. 9112 is not here. 9142. Do you see all those districts of 4444 something? They are all Brazilian districts. They don't have any polio case. But they come out to support us. And 9141 got it because we were in Port Harcourt for the World Polio Day. And when Trustee Joma Kim and myself, we started getting people who are going to work with that registry. So the machines, the dinner, everyone. Otherwise, it was 9126. They are all Brazilian. It's a shame. We should plan to pick them this year. Top countries by number: Brazil, USA, who don't have any issue with this. They can do like what some of us did. Now, what is this good to still don't have? They raise the highest money. They come to where you come to World Polio Day for the first time in many years. At least Nigeria's not going itself to the material. At least let's clap for ourselves to try it. And let me see that we move from there. Now, when you go to the other one, you say, what will we do? Organizing hundreds and millions of children, deploying hundreds and thousands of workers. Who is the young lady beside you? Who are you? 911. 911 media. Media officer. So what is the media officer did so many the person doing that and you are all wearing red? Together. And this together is not working well, believe me. Okay, you play hundreds and thousands of workers and the surveillance. Now this surveillance we are asking professionally the WHO to do. But you and I are surveillance officers. You see a child that used to be active, and all of a sudden he can't hold anything, he's limping, you report it and you do. So we are all part of it. But what I don't like is that with all these things, if you go to the next slide, we have our own challenges. We can do that, but we have a lot of problems. Displacement, I don't know whether you know this big man. You want to go to their estate, they will put gates. You read the estate, you put gates. Now, no one can get it. So, no, you can have it. So it is very important that we get this, we know we have these challenges. So it isn't telling us that we have challenges. There are, I just mentioned some. There are many challenges. But our job as residents is to find a way to surmount those challenges and find a shortcut to live the challenges and do what we can. Look at what we say. We say we are going to be performant, we are going to take a debate. Let us, we had NIT in April. Can you imagine? See the number. We used to come out in thousands. But in the north, only 800 people came out. The one you won't believe it. 61 came out in the whole of the south, including FCT. One Rotarian came out whose vibration happened. But also one person, Ebonyi 2, Edo 1, Lagos Try 34. How many clubs do you have in that? And that is level 1, 11, and now 1. And that means the presidents, they didn't come out because their name didn't show. You know, apart from this list, you go to another platform, it will tell you who came and where you were. Because when you fill the whole equation, it tells you exactly where you are. So those of you who are in the committee, can you imagine? She has a committee of 10 people, and there are 4 days. If these 10 people come out every day and do only 2 teams, 5 minutes here, 5 minutes here, there will be 20. 20 times 4. The committee alone, if you are only going to check 1 team or 2 teams, and you don't have to travel anywhere, you can do it in front of your house because they must come through your house or your office. Or on Saturday, it's a weekend. Or on Sunday, you are church. We are not coming out. And therefore, UNICEF, the WHO are having a target, we say we have a number. Even groups like Solina just came yesterday into the team. They are making noise. Mark John. When I go to what is that? What is it? My king. There are so many new things. They just spread them. They don't know where from. Even Sultan Foundation or my king, I don't know where they go. And Rotarians, business and professional persons, united in the idea of service, who made a promise to the world that will get rid of this nonsense called polio. And we are not found. So we're going to do it. And we spend so much money. We give money to UNICEF to do the work for us. We give money to them to do the work for us. And they give us money in the General National PolioPlus Committee to pay our staff for me to travel. You know that I'm not using my money. I will eat on Rotary money. It's their money. So come and train you and go. Now, the one was that this is April. Go to the next one for June. Let us drop from 38 to 21. The whole of the southern country, including FCT, including plateaus, is 4 days and 2 days more. And in the north, it dropped from 800 to 535. For us, in technical system, data tells more stories than making noise. So, I am here not to train, but to plead with you that let's have a change of heart. Using you people to inform your club, your friends to make sure that you go out. We're not saying that you should abandon your work. In between the time, before you get to work, on weekends and home, you can do that. Now, but let's say, what are we doing differently? Lagos for sure. We are doing a lot of things. Just the day before yesterday, we recruited 3 more coordinators to go to Zamfara, to go to Katsina, and to go to Kebbi. And it is easy because everybody doesn't want to die. But there are some young men there who are aware of this and say, give us some opportunity, we will go and assist Rotary to do the work. IBRA stands for in between rounds, which I understand is starting this portfolio. And we have decided even the number you saw before in the north is that because Rotarians on Ireland and we're engaging volunteers, primarily the Rotaractors and former Rotarians who can't pay their dues anymore. So we are going to, when we say we are getting the get here, we just happen to know that in that community you are, the people smiling at you, somebody has access to distant robbers and kidnappers and the youth. Whether you like it or not, they're there. And if you're lucky by asking questions or pleading with people, when they tell you, okay, we don't hear, we'll see what I'm doing, you'll be surprised. In Borno, they say, okay, we'll give you this day. This road is clear. You can go and walk that day. So it happens. And only Rotarians can pay. When government don't trust them. When you say you go, they are afraid because they can't protocol. So we have that. The DG has already told you to support with process as you go out. Take your pocket and your bag have sweet biscuits and coke. You can do it as a clerk, which some class I used to do, and take it to your adopted primary health care and do that. So let's increase the donation of process. Let's increase our push for foundation for the retro reimbursement and all that. What is at stake is that polio anywhere is a treat everywhere. So we have to watch it. It is too late for us to stop. And it is not advisable to stop. Because if we stop what we're doing now, we are going to have 200 children who will die by polio every year in the next 10 years. And we don't like that. So what can we do? Let's ensure that we reach our 50 million. Let's join our PolioPlus society. Let's advocate for the polio eradication efforts we have. Let's use World Polio Day and all the national day to do that. Because together we end polio. Thank you.
But I will appreciate it if you can give the NNPC chairman louder round of applause. Yes, thank you, man. So, Rotarians, last year I was out in the ability to Rotarians that please, it's never over until it's over. So, that is never over until it's over. The chairman has said it again now. Please, wherever you are, ODK is the simplest way of reporting it. And like I said, and I will continue saying it, I'm available to any club. The DPPC chairman is available. ODK, you can always have it as a fellowship. Whenever we have a club retreat, please invite the district polio club committee chairman to please come and talk to you more about polio and how we can get involved. So this is what I want to welcome to the other side of the table, the representative of WHO, Dr. Meminat Esson. Welcome, ma'am. So, sorry. Like I said earlier, we are now in seminar training program. We've had the update from the National PolioPlus Committee, and we now have Mrs. Tessa Quintala from UNICEF United Nations Children Educational Fund to please give us the update.
Thank you very much. And I have shared some slides. So let's move them. Thank you very much for inviting me to join you today. Very happy to come here. So as you all know, and as we will also continue to hear today, polio response requires actions from many areas of specialty. And while we have the surveillance to detect the virus, we need the vaccines to respond and prevent the virus from spreading. But then there's the component of advocacy, communication, and social mobilization that makes sure that parents and caregivers know about the virus, know about the campaigns, know about the vaccines, and also accept the vaccine. So this is what I will be talking about, this component. So what we are working on in our, what we call ACSM for short, response, is to really to make sure that all levels of society are engaged in support of the polio vaccination. So we have here advocacy components that are looking at the policy level, influencing decision makers, media representatives, and all of those for the big decisions and overall discussions about polio. So advocacy is looking at that component. But then we are also working on different levels of social mobilization, which is looking at the communication skills of health frontline workers, like vaccinators and healthcare workers. So we're looking at the skills development of that as well. Then we are looking at the community, the different groups that are active in community, religious groups, youth groups, women's groups, men's groups, and whatever platforms are existing in different communities. Then we are working on interpersonal levels, really digging into the behavior change, which is ultimately influencing the parents who make the decision. This is a socio-ecological model, which has been very widely researched, especially in health communication. And the main message is that all different levels of the society need to be engaged for the best results. So that's why we are doing a variety of activities to ensure that all the levels are engaged. Next one, please. So when we are talking about the current situation in polio eradication in Nigeria, there are many challenges when it comes to communication, but the key challenges at the moment are really the consistent refusals, non-compliance of parents. While we are doing continuous work, there are still parents who continue to reject the vaccination for a variety of reasons, and we will get to the reasons in a little bit. Then we have the absence of children during the campaigns. When the vaccination team goes to the household, there is nobody there, or the child is not at home. And again, there are many reasons for that. Most of them, the reasons are operational, but then there are also communication reasons. Maybe the child, the parent did not know about the campaign, and that's why the child was not at home. And sometimes we also know that the child is heated during the visits. So the child is not really upset, even though the vaccination team never meets the child. So there are many reasons again. And then more and more we've been also looking at what we call fake finger marking. Because as you know, in polio campaign, we are marking the pinky finger after vaccination. But
Every now and again, in certain locations, we keep hearing or finding out that children have been finger marked even without the vaccination. And we have tried to look into the reasons for it. So obviously, this fake finger marking puts all children into risk. And also it damages the response. So these are the three areas where currently for advocacy, communication, and social mobilization, we are really focusing on. So then again, when we talk about any kind of communication, and particularly the behavior change communication, it's always very important to keep in mind that not every person is the same. We know not every state is the same, not every LGA or board is the same, not every settlement is the same, not every household is the same, and not every parent is the same. We have different values, different motivations, different levels of information, and so forth. So when we are planning for communication, we need to try to understand the types of parents that we are dealing with, so that we can come up with the interventions that are working for the different, what we call segments of audience, because not everybody needs the same information or same kind of support. So here are just some of the more typical kind of profiles of parents that we are dealing with at the moment. So we have those parents who think that there have been too many campaigns. They feel that their child is adequately vaccinated already and they don't need any more campaigns. So they are disinterested. So our challenge is to try to find the motivation for them to come on board and continue to believe that vaccinations are needed as long as the virus is in Nigeria and in the world. Then we have those that are actually supportive of vaccination. And it is actually important to remember that majority of the parents are collaborating with us. We seem to be focusing very much on the challenges and difficulties, but actually majority of parents, and particularly in the southern part here, are supportive of vaccination. But the trick for us then is to make sure that they keep their support, that they don't fall into the tired parents, but they keep vaccinating their children during every campaign and routine immunization. Then we have those who are hearing rumors or misinformation, and that's why they are rejecting the vaccine. So again, our job is to make sure that they get the evidence-based, the factual information about the virus and the vaccination. Next one, please. Then here we have parents who are often consistently refusing the vaccine. Found, for example, on religious reason, that very seldom, if ever, there's some kind of doctrinal reason for it. It tends to be that there's maybe a religious figure who is respected, who is speaking against the vaccine, and that's why the followers say it's a religious reason. But again, this kind of information, that when people say that God or Allah is protecting the child, response needs a different kind of interaction to try and convince the parent to trust our vaccine. Then we have those that are open-minded, those that might not know enough about polio or know why it is still needed, the vaccination is still needed in Nigeria. So they might need just a little bit more information and a little push. So we need to look into those parents as well. And then we have what we call suspicious parents, especially in particular locations in the north. And in this economic climate, people are sometimes suspicious, why is polio vaccine brought to our house? Because for all other vaccines in general, you need to go to the health clinic. So what is this thing suspicious? Why are you bringing it to the house? So again, this just means that they don't understand the urgency and critical importance of the vaccine for polio. And it is why we are bringing it to the house, because it's so contagious and so dangerous to our children. So we need to try to make it as easy as possible for the children to get vaccinated. But as you see, different reasons, and all of the reasons need different kind of message. Next one, yeah. So I will not go but they are again, and if we look at our social data from the most recent campaigns, the most common reasons given for refusal is, yeah, they are tired of the campaigns, vaccine stage. They don't understand if the vaccine is safe for them, particularly if there are multiple campaigns, that why are you keep bringing the vaccine? Is it safe for a child to keep taking the drops round after round? And then there are a lot of fathers, in particularly in particular northern parts, who are refusing the vaccine. And there's also a reason, I mean, not reason, but explanation for that. But typically, fathers tend to be less involved in child health. If it's time to go to routine immunization or health clinic visits, it's often the mother who goes and takes the child. So the father is left without a lot of the basic information about child health and immunization. And lack of information is one reason why they are. And there are a lot of other reasons as well. But again, they vary very much from settlement to settlement. So we need to have a toolbox of different messaging and activities. Next one, please. So these are just some examples of what we have done recently to address many of these challenges. And while I represent UNICEF here, you all know that all these activities are taking place in collaboration with the government, also Rotary. We have Paul Group, we have APENET, Chikari and Sultan Foundation, Solina, and then also other partners who are working, WHO and other partners who are working very closely with us. So just some examples of what we are doing. So continuous engagement of traditional and religious leaders. This is not a new activity, but it's something that needs to be continued and consistently intensified and strategized. This is relevant all over the country, but particularly in the most challenging states up north. Because we believe that in the communities where they are highly respected, they can influence parents' decisions, and again, particularly in the north, influence their fathers' decisions. Or many of the fathers, not all fathers are the same, but if you are in a more traditional society, community in particular, they have a role to play. Then we have also invested more in recent campaigns, more capacity building of the vaccinators, and then the community mobilizers who are having one-on-one dialogue with caregivers. And the way that you communicate, not only what you communicate, but the way that you communicate can really be critical in either helping or stopping the parent from deciding to vaccinate your child. Because what we know is that if you have a negative interaction with a vaccination team, if they are rude to you, if you don't feel respected, or you don't have a friendly contact, you are not going to be willing to vaccinate the child. And even if you would be on this visit, you are very unlikely to go to your routine visit later on if you don't feel good about that interaction later on. So we are training these key frontline workers on good interaction skills. Then we are doing similar kind of thing for community leaders and also the town announcers who are marketing the campaigns in the communities. It doesn't go so much into the interpersonal communication, but it's still ensuring that they have the basic communication skills to deliver factual, informative, and motivating messaging in the communities. Next one, please. Then we have volunteer community mobilizers in 11 northern states. And these mobilizers are working throughout the year, not only during campaigns. And they have very detailed information about households in the areas in which they work. So they continue to collect child health and vaccination information, and also on maternal health issues, while also helping in the surveillance of affected AFP cases. And they are also accompanying the vaccination teams through the campaigns to the households. So we have continuous support for these key people in the communities in which we work. Then a fairly recent development is also because we have areas with a lot of refusals. We have now started supporting as part of the campaign activity budget special teams, what we call non-compliance resolution teams, who will go daily during the campaign to visit the households that refuse. So they try to resolve the vaccination in the campaign or immediately after. And then there's a healthcare worker, part of the team, to do the vaccination on the spot. Next one, please. Then we have started expanding our engagement also outside community-based organizations and CSOs to work with us on social mobilization. And also there are platforms like Fathers for Good Health in some states, where fathers are particularly empowered and motivated to take action among other fathers in their community. So expanding the response beyond just the campaign period. Next one, please. Then we have also started looking at the digital engagement. That while a lot of campaigning takes place in the communities, in person, there's also a big part of Nigeria is digitalized. People are on their phones, on their laptops, looking at especially social media channels. So in the last two campaign rounds, we had a large social media campaign and that helped reach over 5 million unique users here. And we found that particularly the younger parents are the ones, and particularly younger fathers are the people that we seem to be reaching through digital campaigning. Next one, please. Then the variety of media engagement. So this is looking at the advocacy and the supportive environment for the polio response. So there have been public service announcements by some celebrities like Alidu. There has been media talks in the radio and TV, engagement of newspapers and TV channels. So to try to get as wide of a reach as possible, so that the information goes to parents widely. And the picture there, I don't know if you have come across with this No More Zero Dose song, the video that was done regionally end of last year. Again, using a lot of celebrities in the region. And it's also there for you to share in your engagement if you so wish. So a mix of communication channels are used to get to reach maximum amount of people. Next one, please. Then I mentioned about the misinformation and rumors. I don't know if you've come across with any misinformation or rumors about vaccination. Quite often what we hear is that there are claims that vaccination, including polio, could damage the child's fertility or something like this, which we know that is not factual at all. There is absolutely no medical research and evidence that supports any of these claims. But the information is damaging to our response. So we have an online social listening tool that monitors the social media environment. That if there's a rumor, they can catch it early and then a response can be developed to stop it from making damage. Next one. So just quickly, what have in the recent campaigns, what has come out of all of these interventions? So what we are seeing now is that children are missing the vaccination because of parental refusal. So in the April campaign, we find that about 23% of missed children were because of parents refused to vaccinate their child. In the most recent campaign in June, it has continued to drop. Only 13% of missed children were because parents were refusing. So less and less parents are refusing vaccination, which is the trend that we want to see. Next one, please. And then also the resolution of refusals is getting more and more effective. So now we have the non-compliant resolution teams, we have more CSO engagement, we have more intensified religious leader engagement, and everything combined. So we are seeing that in April, 76% of all refusals were managed to be resolved at the end of the campaign. In the June campaign, 80% of all refusals were resolved. And then that is progress, yes, that is. And then if we look at compare the November round, so between November and April, there's a 30% improvement. So the trend is correct. So we are doing something right. Obviously, the 20% of unresolved cases, that's still a challenge for us. And we need to ensure that it goes down. But we are doing something right so that we are seeing progress. And this is what we want to see. Next one, please. Then we are looking at, and this is also a global GPI indicator, the awareness of parents of campaigns. So in the last June round, from the sample size, 87% of parents did hear about the campaign before the campaign started. And then when we look at the 5 key states, Kepi, Sokoto, Zamfara, Katsina, and Fano, the awareness rate was over 90%. Because in those 5 states is where we put most of our efforts and resources. So there's more activities taking place in there. This is a good result, and the result is actually even better if we use a different data source. But we still need to improve here. And this is also where you come to play. And everybody who's involved in polio response has a role to play in ensuring that parents know that the vaccination campaign is ongoing. Next one, please. Yeah. So I want to make sure that you have a chance to ask any questions. But at this point, I want to thank all of you for your support in our social mobilization and communication efforts. As UNICEF representative, I want to thank Rotary for the tremendous support that you have given us year after year. We really value it. And I'm sure that we continue to work together because polio cannot be kicked out without all of us working closely together. So thank you very much.
Let's do one better. Testament. Thanks so much. We really enjoyed the presentation. So the next on the agenda is going to be presentation by the WHO. In fact, the Nigerian surveillance this is a song.
Good afternoon to everyone here. Good afternoon to members of the night table. I'll quickly take us through a few facts and figures. It's full of figures, but please ignore that. I'll just try to explain. The figures are there for you to follow through with them, why we need to monitor and evaluate the systems. The previous speaker from UNICEF has talked about the basis for campaigns and ensuring that children actually are able to get the vaccines. Now that is the first step. And they focus on vaccines given during our supplemental immunization activities. But from WHO's viewpoint, our aim is how do we ensure that the entire globe is eradicated completely. And in a bid to eradicate, you have to vaccinate children during supplemental immunization activities. And you also have to vaccinate children during routine immunization. So it's basically figures that show an evaluation of our systems, our activities. A lot of what UNICEF does is tied into what happens to us, you know, in our regular presence, in our regular everyday activities. We'll also look at the action plan for 2025 to 2026. We've had a shift in the polio view. What is happening now? How many wild polio virus cases are we seeing globally? Is there a change in how children are coming down with cases? We now have what we call circulating vaccine polio variants. Where in the world are these occurring? Why is it occurring? What are we doing to ensure that that changes? After that, we'll look at from national level statistics, and then we'll come down to Lagos State, just to give us a better view on what we're actually doing. So the outline shows us just what I've just told you is the outline. Now, next slide, please. The Global Polio Surveillance Action Plan is focused on how do we make our surveillance systems more sensitive, much more sensitive. At the phase we're at, we're not yet near eradication, but we're getting there. So we want to ensure that no case, if at all a case exists, is missed. And so they refined the plan that we have to ensure that for the next 1 year, which is now going to be extended to 2027, the systems are tightened. The monitoring and evaluation frameworks are deepened, and how we carry out our surveillance, whether it's WHO, state, Rotary, whoever it is, whichever partners, will be able to ensure that our efforts lead to no child being missed. Next slide, please. Now, what is the context? They looked at the plan that we had and implemented between 2022 and 2024. And you'll agree with me, if you know the plans, or if you know what we call the polio map of the globe, we are having continued wild polio virus 1 in Afghanistan and Pakistan. As of today, we don't have any such thing in Nigeria. You'll agree with me, am I right? Yeah. But we know that the domain of Afghanistan and Pakistan is now the next where you're having wild polio viruses. And in late 2021 and in 2022, we had importation of the wild polio virus from Afghanistan and Pakistan into Africa to Mozambique. Yes or no? All of a sudden. We've had continued detection of what we call our circulating variant polio virus in 25 countries in 4 of our 6 WHO regions. Afro, where Nigeria is located, is one of the 6 regions. We've had a wider use of our novel oral polio virus 2. It was first introduced in the northwest. So, which is a better form of oral polio virus that has less state to become something else, the one that has been said. Before it occurred, it was Nigeria that was used testing ground, and we found that it used a number of children who might go to and get so within, please go back. I'm not going yet. Thank you. Within the African region, they've continued to 61 orphan polio viruses. What? As the name detects, an orphan is one who doesn't have father or mother, can show up and not have a linkage to any identified poliovirus. All polioviruses have a genetic linkage, just like human beings, and they're detected. And they can tell you that the one that showed up in Ibadan is linked to one that came from Zamfara State, and the one from Zamfara State came from Niger. They will look at the genetic linkage. But when you find an orphan poliovirus, there is no association and no linkage at all with any other previously identified poliovirus, which means that there's been a problem with the surveillance system. It means that that poliovirus has been existent, circulating, moving from one child to the other, causing outbreaks, and has mutated to become something totally different. Therefore, they cannot link it to any current virus. How did they know that the cases in Mozambique and Malawi came from Pakistan? They did the family tree and genetic linkage. That's how they knew. So the linkage now came from Afghanistan and Pakistan. And the orphan viruses are a big issue for us because you want to trace where the virus is moving. It moves with people. It just doesn't show up. But it means that if you have it circulating, it can change into something else and infect many more children. Also, another issue is that we're having different polio events and outbreaks in places like Canada, Israel, the UK, and the US. In New York 3 years ago, they picked up using what we call environmental surveillance. So we have our plastic virus surveillance of human beings, and we do environmental surveillance system in sewage, following sewage. You may not pick up polio virus in human beings, but you will be able to track how it is moving using sewage samples. And they were able to pick in Canada, in Israel, in UK and US. And then they picked one person in the US who belongs to a religious group that does not believe in immunization. And that was how he was introduced into the country, did not show signs of polio, but was able to shed the polio virus. Luckily, they don't have bush attack there. They have what we call proper sewage treatment plants and water consent systems, but they take samples to monitor what's going on. Remember, last, polio anywhere is what? A threat for polio everywhere. Next slide, please. So this is just a strategy that they're going to extend to 2029. Our first goal is to ensure that the entire world is certified of one poliovirus 1. So 2 doesn't exist, 3 in isolated regions. The 17 variant poliovirus, which is the outbreak we're having in Nigeria right now, mostly in the northeast and in the northwest. Next slide, please. Now, if you just look at the strategy, how do you want to refine surveillance? Surveillance is what? Systematic process by which we're tracking diseases, not just one day, every day, Christmas Day, New Year Day. And if you do not have a sensitive surveillance system, you will miss poliomyelitis cases. And when you miss them, the opportunity for it to spread and become a massive outbreak, just the way COVID-19 started in one and became a pandemic, exists. So you need to look at how quickly can you pick a case if there's one. If there's one in Oluyole area of Ibadan, how quickly can the system pick it up? Who are the people who work there? How will it spread? What is the immunization system like? Who reports it? Does the family believe in local medicine or believe in what you call it, our own what do we call Oyibo kind of formal form of healthcare? We have what we call the orthodox and non-orthodox healthcare. Where did they go for treatment? Was it a local bone center or they went to a general hospital? If they went to a general hospital, who reported the case? Who saw the case? Which doctor or nurse knew that this is potentially a possible polio case? That's what we mean by timeliness of detection. Once you can pick up that case quickly, then there's an opportunity to launch a campaign and an outbreak response to ensure that that stops where it is and doesn't spread. Where does that child live? How quickly? And where did they move to? What church did they go to? What mosque did they go to? Which school? Did they travel to go and see their grandmother during the holidays? One child with polio can infect 200 other children. One child who is secreting the polio virus will infect 200 other children. How old is the child? Under 1, was the child crawling? Was the child 5? Remember, even adults can have this polio virus. So timeliness of detection is key in terms of how we mobilize resources. Where do we get money from? Where we buy the vaccine? Where are the people to know? Everything depends on how quickly we can detect. Second thing is, we look at national and subnational surveillance. Who is doing the work? How effective is the system? Where are the healthcare workers? Everybody is rushing to Canada and America. How many healthcare workers do we have? The ones that we have don't want to die on the job. Please, I can't come and kill myself. I saw one child that was dragging the leg. I forgot I was too busy. In fact, I was hungry. In fact, they didn't pay me my salary. Please, I don't have time to report. What are the systems doing? Are we doing Akofofo in the neighborhood? I saw Mama Lan raise a grandchild. Look, that child, that leg is not straight. Is it your business? It is my business, because it could be that that child could potentially be someone that is carrying the polio virus. We have associations within communities. Do they look out to say the health of children is tantamount to helping us to declare polio virus over? What is the nation doing? What are the laws that ensure that all children under the age of 5 must be immunized? Because once you can have children immunized, you will halt the outbreak. When you have circulating vaccine polioviruses, what do we do? We have an outbreak response that includes all children under the age of 5 getting 2 drops of potent NOPV2. The third thing is gender equality. You will agree with me that traditionally girl children are invisible, although it's no longer like that. But if you have a male child who cannot walk, parents will do anything. Right now, of course, a female child is somewhat equal, but in certain areas of the world, they will prioritize the health of a male child over that of a female. Are we agreed on that? Yeah. And in certain regions of the world, they realize that what we call gender mainstreaming must be brought into health. So wherever there are children, you want women to enter into those areas, and you want to educate people to know that a child, whether male or female, is equal, and that the disease does not know the gender. So more women are being brought in to ensure that they can track all children irrespective of their gender, and that a female child who is living is the same as a male child who is living. They will tell you culturally, locally, whether it's Africa or other parts of the world, this child is going out of the family, but the male carries it. And the impact on how they seek for healthcare is what now is important. So they changed that, and they're looking at gender equality from education to how they train people who follow the outbreaks. The third thing is integration. How many partners? Of course, Rotary International has always been part of the. How many partners are involved? Who is going on? How much money does UNICEF have? Does Rotary have? Does WHO have? I remember that the Baba, we were saying something about Sultan Foundation and Solina, saying that these are children when Rotary is a great-grandfather. Yes or no? Yes. And they are making moves, and he was complaining that you members, esteemed members, were not on the fields. Meanwhile, new NGOs are coming and are getting involved. Am I right, sir? That was the message he was trying to pass. What are people doing? The government cannot do anything. The government cannot do everything. Next slide. So that's the basis for that extension. So they're looking at the following things. How do they enhance and sustain our acute flash paralysis sensitivity and surveillance and timeliness? They want to optimize our environmental surveillance network and increase the number of sites. We have 5 sites in Lagos. They're hoping to expand. All over the country, they have over 350 sites in every state. They're looking at certain types of surveillance to say people who have an immune deficiency are going to, if they're exposed to the polio virus, in a child that should have multiplied to 10, somebody whose immune system is not functional, it's become 1 million and shared into the environment, and there's a potential to pass it on to other people. They want to look at our lab, because you pick your sample, you must go to a lab. And they want to look at the capacity and the standards of the lab to ensure that our labs can actually pick the cases if they are in samples. They're also looking at how do we share data? How do we share data? During COVID, nations were sharing data, yes or no? Because everybody knew what the potential was. So a case anywhere is a case somewhere is a case anywhere. And you can look at what happened in Afghanistan and how we got back into Africa. Then, of course, they're looking at management and accountability. Who do we hold accountable when things are not done right? Next slide, please. So I will skip this. We have another, this is details of, okay, let me just take it. Now, if we are talking about how are we going to improve our surveillance sensitivity, we want to detect in a timely manner, very quickly, anytime we have cases. We want to expand environmental surveillance. So AFP surveillance, active flaccid paralysis surveillance deals with human beings. Environmental surveillance deals with sewage systems where we track what people are passing out in the stools. So that one is silent and may not come out. So they want to ensure that they expand the number of sites so that they can pick any case. They want to say that if you have a case in a human being, it should be picked up in a timely manner. The health system must be notified. It must be investigated. Stool samples must be collected and sent to the lab to ensure that within a short period of time, if it's positive, they'll be able to get a result. And then, of course, after you do that, next is what we call an outbreak response. They want to look at sequencing. They are upgrading the labs. Now we have our Ibadan lab and Maiduguri lab can carry out sequencing. In the past, they pick samples and send it to the CDC in America. Now, from picking the stool sample to picking up a polio virus, they will know what the grandfather and the grandmother is and where they came from. So that helps the nation in shortening the time. You send abroad DHL, we say the sample is missing. We need 2 weeks for the result or 3 weeks. Now, within a 21-day cycle, you can actually tell what that sample is and where it came from. Also, they want to now deploy direct detection in the labs that are enhanced. Next slide. So let's just look at national. What happened at the national level? We have highlights we have what we call the epidemiological week in surveillance. Week 1, so from Sunday to Saturday is an epidemiological week. This week we're in week 33, but this data is also week 31. And as of that time, they have picked up 8,951 acute flaccid paralysis cases. That does not mean polio. It just means that the potential for somebody who has acute flaccid paralysis to become a poliomyelitis person determines on the stool samples and whether it's positive or negative. So anybody that comes down with acute flaccid paralysis is picked. 2 stool samples are collected and go to the lab. So we know, okay, these are not polio samples. Right now, we don't have any wild polio virus cases in the country. But these cases were picked from 773 local government areas in 36 states and the Federal Capital Territory. We have what we call indicators that we use to monitor our systems. So if we say that anybody with acute flaccid paralysis may not have polio, but could be polio because those presentations are the same as somebody with polio, they are looking for what is the non-polio AFP rates, which means that how many of those cases were not polio and how many were polio. And we have a standard, and the nation was able to meet that. They now look at the stool samples they picked, were they adequate? Meaning that if somebody with poliomyelitis had their samples picked, could it be detected? Now that matters in terms of the healthcare workers that addressed it and the lab. And the nation was able to meet. The figures are 12.3, 99, and 13.6, and they met the benchmark. Now, if those samples were put through the lab, what did they get from the samples? Is it the enterovirus of polio or the non-polio enterovirus? And there's a minimum of 80%, and we're able to meet as a nation above 10% to 13.6. Now, there's only one local government area in the state at this moment that was not able to even detect one case. And we look at it and say everywhere, whether it's Lagos or wherever it is, you must have a minimum of 3 cases per 100,000 to show that the system is picking cases. That place in Osun State is 0 so far, which means there's a problem. And we're told they have insecurity in that area and they have some other geographic issues as well. Now, they also picked 764 environmental samples and took them to the lab. And we need to have a minimum of 50% of enteroviruses detected, which may be polio and may not be polio. And the nation was able to meet with that. Okay, so we have CVPP, which is our circulating variant polio. And in the northeast, Sokoto and Maiduguri or Bauchi, they are having an outbreak there right now. They picked cases from there, from humans, from a healthy child. Remember, a healthy child can have the polio virus, secrete it and have no issues. Please note that. That immune system is able to cope with the virus. The child will not come down with frank poliomyelitis. What is the problem? The child is shedding the virus. So, from a healthy child and then from environmental surveillance. Just for us to know that the whole span of how we approach poliomyelitis is multi-sectoral and multi-functional. Now, what did the nation do when they found those cases? They had IBRA, I think, sir, you mentioned IBRA. And they also had supplemental immunization activities in October last year. And right now, they will still do some more in northern areas. In the south, we've not had any issues, so we've not had any outbreak activities. Next slide, please. This graph just shows us comparing 2022 to 2020. Where children there's a reduction, really a reduction based on all the supplemental immunization activities. The next slide shows a comparison between 2024 and 2025. And we can see that, which means that what we're doing is working. Next slide. If you look at these graphs, they just show you where they variant, right? See, that is 2020. States covered in blue. You can see it in 2024, and you can see there's a reduction in this year. A migrant farmer from the north moved to Ogbomosho to farm, and the child had not received a single dose of OPV and came down with what? A circulating variant virus. So the country became worried that your response was instigated, constituted, and it was done. And it was made, and we had it. That was the basis for that. In case in Oyo, to enter Lagos, it was spread. Next slide, please. So now I was talking about. Now, can we see that in the south, there's no single red? The last orphan virus nearest to the south was found in Nasarawa, and immediately they did a response. And you can see the northwest, you can see the north central, and you can see across northeast. Orphan viruses scare the system because it means that there's silent transmission moving around and potential for spread. Next slide. Now, these are circulating vaccine polioviruses that show up either in environmental surveillance or in human beings. You can see that 2024, this is still 2024, 12 months ago, 6 months ago, 3 months, 12 months, 6 months, and now 2025. Can we see a reduction in the red dots? So, which means that every time they pick a case, the next thing is to make sure that the entire population of children under the age of 5 gets 2 drops. Right now, we only have 1, 2, 3, 4, 5, 6, 7, 8, 9 cases, areas where they pick cases, and the ones in yellow. And they make sure that they are having campaigns. So that's why in the northern areas of the country, we have continuous campaigns to ensure that any one child that is positive, every child in that area must be immunized. Nothing in the south. Next slide. So these are places where they picked 2 samples and ES samples, and they've sent them to the labs to say, what is the outcome? Is it wild poliovirus? Is it circulating variant poliovirus? What exactly is this? So we have samples from 11 states in green that were pending and waiting. In Zamfara, we know that there's insecurity, banditry, kidnapping that doesn't allow the health system to immunize these children. So there are certain areas in Borno, the same thing, because of Boko Haram, and in other areas, there's insecurity. There are areas where no child can be immunized unless they bring the children out of that area. So they have health system issues that are disrupting our normal immunization pattern. Next slide. So this is, we pick up cases in human beings, and they track it, and it's tracked over 4 years. For Lagos right now, we have a reduction in the number of cases we picked at this time last year as compared at this time as compared to 2024. And you need to maintain the number of cases picked so that all those cases will have samples picked from the next slide. Now, this just shows us, I talked about the indicators they use to monitor how efficient the surveillance system is. And anywhere where you see green, they met up. In yellow, they may not have. In general, we're meeting up with our indicators, but we're still looking for those children that they are hidden or you cannot find or you don't even know what's going on. Next slide. This is just showing us that in all the 36 states plus FCT, we have the environmental surveillance sites. In FCT is the only place where they actually go to the sewage treatment sites. In Lagos here, we have in Apapa, we go to where we have lots of slums and people have low routine immunization coverage. We go to Makoko, we go to Surulere, and when we pick those waters every month, they're sent straight to the lab and tested. So this is just showing us that the total number of samples picked were 764 by the end of July. Next slide. So let's look at Lagos State now. That was for the so just showing us the maps. You look at the density. Lagos will implicate us in terms of spread. So the way you would have an outbreak response in other states is not the way we have it in Lagos, which is why when Baba was talking about the fact that nobody is going out to supervise, we need more supervision in Lagos State. This shows us our international border with Benin Republic. And the only weird place in Lagos is Badagry local government area. And we know that viruses don't know borders and anything can happen. So cases can cross from Benin into Nigeria and so forth. You look at our geographical waterways and look at how does that affect the healthcare system? How accessible are certain areas in Lagos to immunization campaigns and routine immunization? Then look at the density. We can see Badagry in yellow. So when we're preparing for teams, we need a profile of the surveillance system in Lagos. Next slide. This is our indicators. By the end of July, we had 217 cases from January to July. We had 3 cases that had gone to the lab at that point in time. We actually had 224. We didn't count because two samples had not been taken and no results. As of today, 0 wild polio virus in Lagos. As of today, 0 circulating vaccine variant virus in Lagos. Can we go back to that slide? So this we met all of them. ATLGs were able to meet the 2 indicators, which means that if two samples were collected, the samples were well collected, got to the lab in good time, and when they checked them, there was nothing in there. Also, that our non-polio FP rates, which is 3 per 100,000, were able to meet above 3%, 5.1. And our cases that went, all of them, they were able to pick something from them, but nothing was poliovirus. Next slide. So this just shows us how do we report. You can report at state level, national level, state level, ward level. And we're very concerned that some wards pick no cases. We call them silent. If those wards are silent, are you sure there are no cases there? So we're just looking at the number, 40% at this time last year, 41. We want a minimum of 80% of the wards to have reported a case to ensure that we're covering everywhere. Next slide. This is just to show us our indicators. We said 80%, so only 4 were not able to meet up. We have Agenia, Jerome. Next slide. This is just showing us help-seeking behavior. Where people go to seek for help. His child came down with acute last paralysis, and he left his juju shrine to go and seek for medical care. When they reported, we went there in Lagos mainland, and when we asked him what made him come to the hospital, the child before that had died of acute last paralysis. So that was what made him. So we don't look down at where you go to. Wherever they're seeking care for a child, we go there to go and investigate. We were able to take the 2 stool samples. That was 2018, I believe, and went to the lab. That child did not have wild poliovirus, but had taken an injection that had paralyzed the nerve in that area. That was why the leg was paralyzed. So when we say apoplastic paralysis, all the things under it may not be polio, but polio could be one of that. And when children have what we call injection neuritis, can trigger latent and silent poliomyelitis, which is why I said a healthy child can be shedding poliovirus and show no paralysis. But if that thing is polio, one child will infect 200 other children. Next slide. This just shows us the vaccination status. In the north, most of the children who have AFP will have 0 dose, or at most 1. But here in the north, we have 2 0 doses, and those people are not residents of Lagos State. So we've also tracked their immunization coverage to know, are they living in areas where no teams have gone to? Is there no PAC in that area? Do people not take immunization in that area? Because surveillance and routine immunization are twins. If one is low, the other one becomes high. And if one is high, it's able to cover for the other. Next slide. This is just our non-polio FA rate. We can move on. Next slide. This is our stool adequacy to show us that the stool samples are taken and they are optimized to ensure that whatever is inside that stool will be picked up. Next slide. This is our what we call is the outcome of the stool sample analysis. Next slide. Like virus. So usually you will not find high rates until after campaigns. Remember now, this year is 6.3, and we need a minimum of 5%. Next slide. So another part of what we do is we do what we call active case search. We don't just sit down waiting for the cases to be reported. We actively go with the surveillance systems. In every LG, we check treatment, check community informants, we go to pharmacies, PMVs, we go to hospitals, public and private. We go to churches where people seek for care. Anywhere where a human being seeks for care, we go there to ask, have you seen any child that cannot move the hand and leg in the last 2 weeks? And we track it. We use our phones, we use ODK. If you did ACS, active case search, and you can see, I think it's 100%. Can we see? We prioritize the kind of health facility, high, low, medium, and then you can see 94%. Red, you can see Abafa had 0. None of our medium priority sites were visited in the month of July. So we track how actively are we looking for cases, where were cases reported from, where are they linked, to ensure we're not happy. Because all cases will not report and present both setters that will treat both, and the child will live with a baby. When we see those cases, we tell the bone setter, continue your work. When you finish, please come to the hospital and go to physiotherapy to ensure that's treatment. And then we also take 2 samples to ensure that it's not polio. So this is now another angle of how our system, and that's why they're saying they want to sharpen the sensitivity of the system to ensure that any case anywhere is not missed. Next slide. Now let's look at environmental sample and surveillance. We have 5 sites. We have in Nigeria, Maracana field site. We have behind the Makoko market. We have at Itire Road Canal between Itiaraba and Utushelu Port. And it's a massive canal that goes through like 9 LGs. So we have a spot where we pick it every month. We have Gaskia Road site where Gaskia Bridge is in Akapa. And then we have a Alachijimo Street site in Street. These areas were picked from places that they were the first wild poliovirus detected in Lagos in 2012 was picked which is why it's cited, whether there was a polio site, whether you have a speculative vaccine polio site, whether it's a dense neighborhood, whether there's no routine immunization, or people reject routine immunization. Those are the places where we know that you have enhanced number of cases that may be silent. We go there, we pick using a bucket, a stainless steel bucket, the sewage, and we put it in a 1 liter jerry can, and it's immediately put in ice and goes directly to the bottle. Just the way we take 2 samples from a human being, that's how we take the sewage samples. And we must collect those samples before 8 in the morning. Because once the sun comes up, we all know that the polio virus dies once it's exposed to heat. Yes or no? The minute it's exposed to high heat, it will die. So usually by 6, our teams are out there. We have people who collect it. They must collect it and immediately put in ice and send to the lab to ensure that if that sample is hot, anything that was there will die. So we also track and we monitor. What time did you collect it? Did you fully pay for it? How full was the container? Did you pack it well? Did you close it? Was it in ice? When it got to the lab, what was the temperature? Because if the temperature is too high, they will discard the sample. So we monitor the systems and we can see, we look at detection rate. What did they get when they went through the lab? What time did they collect the sample? And we have a set time every month for all the sites. Was it collected on schedule? It's meant to be Thursdays. You can collect on Tuesday. Now, if it rains, we don't collect the sample because rain will dilute what you can find inside. Now, when you collected it, you collect it at the scheduled hour because we want to be sure that that sample will not be hot. What was the condition of the sample? Was it good or bad? There was one that was bad, not because it wasn't well collected. They did not lock the sample and we're supposed to use tape. When it got to the lab, it had opened and it leaked. And the lab said it could be that leakage that could have had a polio virus. So they rejected it and asked for another sample. And then timeliness of shipment. If we pick it during COVID, we were not able to travel like that. We put it in the deep freezer, but it must get to the lab within 72 hours for collection. So these are what we use to monitor to ensure that what we're doing will yield results, if at all there's anything in the sample. Next time. So these are just graphs to show off how we monitor. Our sites meeting the benchmark of 80%. Who collected? Did the sample collector collect alone? No, he collected and was supervised. And if it was supervised, was ODK used? If ODK was used, was it sent to server? We also look at what has come out of it from the lab. So you can see here. Sorry, ma'am. Thank you. If this is vaccine, the right polio virus, 0 for Lagos. This is circulating variant, 0 for Lagos. While polio virus 1 and 2, 0 for Lagos. We now look at what they find in the test results. So we keep this monthly so that the system knows if you've gone wrong, we show and we give an alert immediately. This is the one on top is time. How many samples were picked between 6 and 6:30? 11. How many samples were picked between 6:30 and 7? 22, because this is Lagos. So leaving their houses to get there will take time. How many samples were picked between 7:30? Yeah, 7 and 7:30. Only 1. Between 7:30 and 8, 0. And after 8, 0. To ensure that anything that's collected is in the best possible position to have whatever is in it to be detected. Next slide. Thank you.
That more of that.
Yeah.
You can understand the roots of our. Let's do. Thanks so much, ma'am. Thank you. Thank you so much, ma'am. So now, when we come up on the field, asking us all to come out on the field, monitoring and all those. Now you know what we are saying. How many of us have been to Makoko? How many of us have been to Makoko? Going to Makoko is not going to come to that celestial church, but deep down in there. Who has been to Morishoki? Please, that's where we need to go. Come to Ojota, there's a dump site. The population at Ojota dump site is close to 5,000 people. You will not believe it until you are there. So please, now that yes, it's not over. It's over. Every unimmunized child is a danger to every other child. If we, as parents, say, no, I don't want my child to be immunized, and tomorrow that child becomes paralyzed, do we think that child will say a prayer for the parents? So please, in our churches, in our mosques, please let people out there tell them why we must immunize. So before you call next week, I want to appreciate our Nigerians that are on call. We have some of our club members that are not yet presented, but then they were calling us online. So we want to ask them to please introduce themselves. Hello, everyone. Please, can we have your name? Please, can we have your Let's go. We have
just something with us while they get to work on that, you know. You know, Lagos State has taken lots of effort to ensure that we put some, you know, proper schedule, and we just don't do supervision only during programs, especially during polio SIMs. No, that's not what we do as far as Lagos State Primary Health Board is concerned. Because if you do supervision only during programs, it means that you'll be leaving out so many things, like pre-preparation and activities. Will definitely have problems with it. So what we do as far as Lagos State is concerned is whether there's program or not, we ensure that there's a supervision schedule. Yes, and that we call routine immunization supportive supervision. So that actually serves as the basis and the beginning of supervision that will then proceed to, in case there's any SI upcoming. So what do we do during RISS? That's routine immunization supportive supervision. We go around, we check all data, we ensure that all data tools are well filled and, you know, up to date, ensuring that the vaccine management system is actually up top notch.
it's well updated and all that. The cold chain system, as far as the supervision is concerned, is very, very key. We ensure that, what do you use in storing your cold chain, your vaccine? We ensure that their cold chain is that CCA. I don't know, for some of us that have been to facilities, have you seen that blue box? Yes, that's our medical. I know we have some of the Rotarians are medically inclined, so I'm trying to ensure that I communicate, with them using the right language here. So we ensure that every facility has that. And in case some facility do not have, we ensure that if their vaccines are stored at the right temperature, and the right temperature for vaccine storage is +2 to +8. That is very crucial to us, and that's WHO standard. So we ensure we use all these standards and we follow the protocols the right way. SOPs are very important to us, and supervision is part of what we must do to ensure that polio is totally and finally eradicated as far as Nigeria and Lagos State is concerned. So, permit me, maybe I will just use my, okay, yeah, giving me the go ahead. So, now we have talked, I'm giving us just a feedback we have was polio supervision is concerned. It is important because when we do proper supervision, we tend to prevent subsequent outbreaks. Yes. Because during supervision, we ensure that the eligible children are covered, that they get vaccinated. So, and if they are well vaccinated, we ensure this provides herd immunity. When there's herd immunity, there will be prevention of subsequent outbreaks. Then it improves vaccine efficacy as well. Supervision prevents, any how will I put it now, any illicit activity that may want to go on the field. If people are being that they don't want to, implementers can be funny. If you've been on the field for supervision, so when you go on supervision and they see that they are not being left alone, they do the right thing. And with that, we end up having vaccine efficacy. Then building trust. Building trust with the community is very important. And that is what supervision helps us to develop. When community members see that, WHO is on the field with their jacket, they are seeing people from the world, so different NGOs supervising any SIA's activity. They see that, it means that the government is not just bringing anything to them anyhow. Because when they see us in the field, they tend to feel that the government is bringing this again. Maybe it's expired or about to be expired, or maybe they are using them as guinea pigs. These are live reports from the field. But when they see that we have lots of NGOs on the field, like the Rotary Club, the WHO, UNICEF, supervising, including the state, they tend to build trust. So the community, that's why we want more supervision, from all ends in order to build community trust. And then that's the second slide. Thank you. Yes. Yes, thank you. So as before, when we do proper supervision, one of the important things that helps us is supporting health workers. When we go on the field, it's not just about castigating. We don't castigate. We provide supportive supervision, and that's to correct politely, on the field, right there on the spot, if we see anything that's going wrong, either with the vaccine storage, either with the way it's been administered to children. We know that when we're administering the oral polio vaccine from the dropper, their fingers is not supposed to touch the tip. The tip is not supposed to touch the child's mouth. All those things. That's what we tend to check when we're on the field for sports supervision. Next slide, please. Thank you. So key objective during supervision is to ensure that there is proper coverage. And when we're talking about coverage, we are talking about the eligible children now. Who are the eligible children that we're talking about? The under 5. Yes, the under 5. We need to ensure that all eligible children are vaccinated. And there are some areas that some of the teams of the field may not be able to get to. But for the fact that we as Rotarians, you as Rotarians, as we are all here, in your vicinity, those areas that people don't come. So during supervision, you can just take the full step to help supervise those areas, just to ensure that there is proper coverage. They're talking about quality as well. During supervision, we ensure that proper quality of vaccine is monitored, and that is what we do. Then safety. Safety is very, very important, which is one of the things that tends to cause the community to lose trust in the government. As far as Lagos State is concerned, Lagos State is trying. I can say that, and with the support of NGOs, of well-wishers like, Rotary Club as we have it. Thank you. Next slide. So next, this is just continuation. So still talking about key steps to success, talking about the importance of this supervision that we're talking about. What are the key steps that tends to bring about successful supervision? That what we need to just no, we know that when we want to prepare or when we're preparing for any program, we have pre-implementation activities, we have the during implementation and post. Those are the 3 steps. But what are the activities in the pre, during, and then post? Because those are the steps that needs to be really supervised, not just to go on the field during the activity itself. But before the activity, like the national gives us something they call dashboard. From the dashboard, we as the state, we assess ourselves as far as our readiness for any campaign is concerned. And for all campaigns, we have the dashboard. From that dashboard, we tend to check the development of a detailed micro plan. You can't go to the field if you don't know where you're going to. You can't go to the field if you don't know the number of estimated children that you want to go and vaccinate. So that's talking about development of microgram supervision. It has to be supervised. So that's what that is. Also, during the pre-campaign planning, we also do training. We train the vaccinators. We have to train people. We recruit. We train from time to time so that we can ensure that the right information is passed across them. Like from the main campaign, things started to change. We had new instructions, new information. So we needed to pass it down. And so the training from that NIPDS or was really different. It was different. A whole lot of information, involvement of the community leaders in making sure that they help us to recruit good people that we know are genuine and have interests of the community at heart. When the community members are involved, especially in selection, in recruitment of implementers, we tend to have a successful campaign, and that also has to be supervised. So supervision in that area is also important, and that's what we did. So now in conducting we also did we conducted the independent monitor training. Aside the government, the NGOs, we also developed, we had the independent monitors, people that are unbiased, that do not stay in the community. What they do when they go to the field is that they just check, they have their own checklist and they follow it to the letter. Nobody can influence their decision. So that's what we mean by independent monitor training, and they go on the field for supervision as well. So those are the different activities that we do under the pre-campaign planning and training. For the in-process monitoring, in-process means during the campaign, now the campaign has started, day 1 to that day 4. What are the things people need to help us supervise when they go on the field? With that, I know that from the program, I saw ODK. ODK is what we use. Everybody uses ODK. There are sets of questions on that ODK. It's a checklist that has been developed and it keeps updating from time to time by the national. That is very crucial to us. From time to time, we know that people have developed and people have had a lot of challenges using ODK during implementation. We know that some may not be able to interpret the English very well, it causes frictions like that. So at the end of the day, they tend to give us reports. Because the reports that is national sent to the state, we disseminate during evening review meeting. I heard the moderator talking about evening review meeting. During evening review meeting, we tend to talk about all the challenges during the activity so that the following day, all those things will be corrected when they go on the field. So those are the things we correct actions. We interact with other surveillance like polio SRA data, with other surveillance system as well, such as the AFP. Now, let me pause here. Talking about the AFP, there is something that Lagos State Primary Health Board has, and that, with the support of Rotary Club and every other organization, because it's very, very key. The AFP tab. AFP tab has been printed, lots of it. In fact, according to each ward and each implementer, just to ensure that each implementer has one, and we know that's whole lot and it costs so much. Rotary has been so helpful in that, and also with the April, Rotary Club has been so beautiful, and I expected not everything at this time. So thank you very much for that. But what is important of that AFP tab? We know that when people get to the field, they forget to ask important questions. We don't want them to cram it. We know that the brain, everybody's thinking about what to eat, how to make more money. And making more money is what led them to join as an implementer in the first place. So what is it is on it's these key questions that needs to be answered on. So when we go on the field, we need to encourage this for them to just read. You just read and turn it and just read it, because I just find it difficult. Like, why are you so? Why can't you just turn the card instead of racking your brain? When we go on for supervision, we ask you, okay, have you asked this question? Have you asked it? Most of them don't know that the question we're asking them is on that AFP tag, and it will just talk about old laws, talking about AEFI, you know, whether there's a living child and all that. So those are the things that covers. So those are the things that we check on during implementation, and then review meeting, which he has already talked about. He mentioned briefly. During evening review meeting, just as I said earlier, we assess all the challenges, the non-compliance, which I know that the UNICEF person was talking about when I came in. Yes, the non-compliance, all the challenges of the field will be addressed or mentioned. Then the following day, that's the first thing that we tend to correct first, even before, you know, the LGA team, the state team, they go on the field to ensure that they correct all the challenges or error from the previous, and from the results that you saw, 76% in the first campaign, and then improving to 80%. I mean, Lagos State is improving, even though it may not be as fast as we expect, but at least something is being done. Thank you very much. Next slide. So this is still talking about other steps to the key, the importance of supervision. Yes, so please go back. Okay, so after this, I think I missed a slide. So I'm going to tell us what it's like. That's post, because that's what the fifth one is talking about, the post-campaign supervision. You know, after the campaign, but day 1 to day 4, we always have 2 days more. That 2 days more is just like, oh, probably did I enter into this hard shot that we hope? At that point, those 2 days more, that is when supervision is, and it's very, very dear. Not on the first day. No, most people don't go out on the first day for supervision. But that's 2 days more, because we want to ensure that any area that was left, any settlement that wasn't done properly, you know that it is well covered. So those 2 days more is really crucial to us, and we know if we have not been doing it, so we should please help us, help the state. We are all Lagosians. That's why I've been living in Lagos. It's not about where you are being, you know, you are from, you're originated from or something. Let's ensure that we add this, you know, to our portfolio when we are going out of the field. So next is, so that post-campaign supervision, very important, and that is what that 2 days mop-up is mainly all about, and that's what we do. So also during the post-campaign supervision, we ensure that the high-risk areas, these areas, high-risk, what do we mean by high-risk? Areas that are, you know, that are volatile with fluid, let me use that language, with fluid populations, you know, always going to like the borders. You know, we have international borders in Lagos State, we have, you know, interstate, even the world borders, you know, inter-LGA borders, and we often do what we call handshake. When we do border handshake, we do meetings before that. When we supervise all these critical steps, because if Lagos State is starting their whole campaign while local states or the Cameroon, you know, just that they are not ready to do their campaign yet, but we must ensure that the children within that vicinity are covered. They must be aware that something is happening in Nigeria or in Lagos State, in case you are not ready or you are in another phase. But ensure that you still come in case you wish to take. They must come to get vaccinated, because if end process, there's something we call end process, that's after the campaign. Supervisors from national, from WHO, they go to the field to ensure, to assess, okay, how far did we do during this campaign? If peradventure any of those children are met by that time, it will be counted against the state. So that is why supervision is very, very key, and we ensure that we do what we call border handshake. That border handshake is critical for us, and we ensure we supervise it to the letter. So it's one of those things we do. And then hard to reach population. The hard to reach population is talking about migrants, the nomadics, you know, the Ilagers, those that goes and come. Sometimes when they go before the campaign, you will see them coming back after campaign, not getting vaccination. not getting vaccinated, and this was risk to those children that we've already vaccinated. And it's also always difficult in some cases to even get access. From the, we still see other challenges that we tend to, to encounter when we go to the field during vaccination as far as this polio campaign is concerned. And then security concern, that has been something that doesn't want to leave us as far as this country is concerned. But in Lagos State, we are still trying. We have little or no security threat areas in Lagos State. That is why we are taking much effort to ensure that we don't end up having any volatility as far as that area is concerned. Thank you very much. Next slide. So ensuring that we know that okay, they have important steps to ensure supportive supervision to do all that. Now ensure that sustainability of this polio supervision effort, what do we need to do? We need to ensure that there is continuous community engagement. Our health education system, as far as Lagos State Primary School Board is concerned, is top-notch. Please, I want us to clap for our health education system. Yes, we are trying because there is always continuous engagement. There's something we call linking primary healthcare services with the community in our real microgram, because we develop real microgram for every quarter of the year. Yes, and this is something that we do. There's community linkage. We carry out meetings with all the artisans, encouraging them to ensure they get vaccinated, and that when there is any SIA, as far as that is concerned, they must oblige. That part is very important, and the health education officer has been doing that very well. Partnership, just as we're doing here now. Lagos State partnering with the Rotary Club, with WHO, with Otolina, with UNICEF, with lots of NGOs, and NGOs keeps coming on board. We still want more. Because there's lots of grounds to be covered. Still talking about training and capacity building, like what we're having here now. It's still training and capacity building, because you may have heard or learned what you think that because it's wrong actually before, and we have already gathered more knowledge. So that is one of the things we're doing here, and we do it from time to time, especially for the health workers of Lagos State Primary Health Care. Yes, Lagos State is trying as far as that aspect is concerned. Data-driven decision making, just as what we saw in other slides, in other presenters. Lagos State takes decision. Yes, big data. When we talk, we make decisions based on the data available, and that's one of the beautiful things. With supervision, if you say you want to go to the field and you've not accessed the previous campaign, you've not accessed previous data for a particular area, then what are you going there to supervise? So it's good that we do this supervision as far as this and make proper decision using the data-driven approach. Next slide, please. So in conclusion, polio supervision is a critical element of the global polio eradication initiative, which is what we have actually been talking about. It plays a vital role in ensuring that all children are vaccinated against polio, protecting the community from these debilitating diseases. And it is not just debilitating, but very cost effective. Very expensive rather, not cost effective. Very expensive, because some people, even the ones that say they have money, they're elites in the community, they feel like, it's just to go in and get treatment. By the time you start the treatment, that's when you know that this thing is very expensive. And from a child, how many children have had contact with that child? So this thing spreads. So we want to ensure that we eradicate this as much as we can, and I know Lagos State and Nigeria as a whole has gone into the peak of it. It has to be done, it must be done. By adhering to the principle outlined in this presentation, we can enhance the effectiveness of polio supervision programs, leading us closer to a polio-free world. Moving forward now, we must continue to prioritize polio supervision, address challenges proactively, and strengthen our commitment to achieving this vital public health goal. Supervision is a vital public health goal. It's one of the things that, when I was doing my MPH, my professor was always like, when it comes to that, when we go to that topic, I'm like, everybody, we needed to just do so much as far as supervision is. And we were like, why? On getting to supervision, as far as a public health expert, they were like, you're not taking it so serious. Like, without supervision, all your tasks, the goals, all your plans will just, it will look as if you've not done anything. So supervision is to ensure that you are aligned and you stay on course, that you achieve your set target. And our set target for Nigeria, for Lagos, is to ensure that there is 100% polio eradication, and I know we can achieve it. with you, with Lagos State, with you especially, supporting Lagos State, I know that polio can be eradicated. Thank you very much.
Let's give it to her. So, one appreciate all Rotarians for this long, but then we go to one of the most important aspects. All we've been told earlier on, this is not the angle that will not bring out all these things that we've told if you really understand it and want to put them into use. So, we want to call on the next speaker from the International PolioPlus to please give us a talk on ODK. How many of us are ODK on our phone, please? Wow. Just one. That's why we have just 34 reporters. So please, let's put on our phones. Android phones. We are not talking about the senior iPhone class, but the Androiders. Thank you.
Thank you very much. Good afternoon. My name is Benga Olayole, National Program Coordinator for Rotary PolioPlus. Thank you for your patience, for the time and your attention. And before I continue, let me first and foremost thank my colleague from the National EOC, Tessa Rintala. She was just telling me how beautiful it was in Finland. She's from Finland, and she was on vacation when I sent the message that we will need her to attend our PolioPlus Seminar. And then she promised she would be here, and she has fulfilled her promise. So please give her a round of applause. Thank you so much, Tessa. We appreciate you. Also, my thanks to WHO. The message got to her yesterday. Yes, we sent the message weeks ago, but along the line of the bureaucracy, she did not get the message until yesterday, and she was still able to make it here and deliver a wonderful presentation. I'm sure we all agree with one of them. So, before we go on, we've been doing this a very long time. I've lost count of the number of seminars we've had here, and I must say, the turnout today has been very impressive. So please give yourself a round of applause. We've had seminars that will be looking for 20 people. Rotinajide is here. We have been in the District PolioPlus committee together for a very long time. And this is a very, very wonderful turnout. Congratulations to the District PolioPlus team. Congratulations to the DG and everyone else involved. Thank you so much. Without further ado, I just want to give us a background to why ODK is important. You see, last year, the money that I'm aware of, what I'm aware of that we gave to the Nigerian polio program as Rotary International is over 44 billion naira. That's the money we gave that I'm aware of. But later on, we found out that on the ground, UNICEF even got more money than they reported to us from Rotary International. So, obviously, what we gave is over 50 billion naira to eradicate polio in Nigeria. That's a lot of money. That is a lot of money. Whether you put it in naira or in dollars, you are talking of a lot of money. But you see, when we sit at the table and we are discussing impacts, nobody mentions Rotary. Why? Why is it that nobody is talking about Rotary with all the money that we give? If we were to withdraw our support today, the program will probably collapse. But when we sit at the table and we are discussing programs, nobody talks about Rotary. And the reason is simple. We give money, but we have not made it a priority. People say it's a priority, To me, it isn't. Because when we start with the DTTS, we start with the DTA, District Training Assembly, all the training sessions we have, you will give us 15 minutes to discuss polio. So to the district, it is not a priority. If it is a priority, you give us sufficient time to talk about it and to mobilize Rotarians. That is why our presidents who are here seated, they cannot prioritize coming out for 1 hour on Saturday or 1 hour on Sunday with 5 or 6 members and supervising teams, because it's simply not a priority. But if it is a priority, definitely we'll have more than 34 entries from Lagos. Because me alone, combining it with my non-compliance resolution, combining it with my coordination, combining it with my ferrying teams up and down during the round, I still managed to put in 10. So if we have two from all our clubs, we'll be talking of thousands of entries. So I want to beg us. We are the representatives of the club. We are the ones from the different clubs who have a big voice. Can we make it a priority? Are we promising to make it a priority? Can we promise to make it a priority? Thank you very much. And I promise you that Rotary Nigeria National PolioPlus Committee, we are ready to conduct this ODK training as many times as you require it. Before the last June round of activities, I had this training 8 times for Rotarians across southern Nigeria. 8 times. And we still had 34 entries. So I'm not bothered, I'm not disappointed, I'm not discouraged. But I just want you to go back to the club and beg everyone, let's make it a priority. And it's not hard. It's not hard at all. You know these things will come to where you live. And even if they don't come to where you live, they come to your local government. Just go there. See 1 or 2 things. Enter it on your phone and leave. You have done your job. Right? So we begin to see. So that when we now sit at the table and we are discussing polio, they will say, oh, Rotary, they gave us 5,000 entries. Rotary is number 2 among the people that came out, because government will always be number 1. Yeah? After God, some people just found out. Hello, Kwan 1 and Kwan 2. They just found out that after God, na government. Eh? Somebody said Kwan 2, which Kwan 2? Don't be confused. So let's go on. So what is ODK? ODK is open data kit. It's a questionnaire available on an app. When you go out to supervise teams, you will use it on your phone, your Android phone. I'm sorry for those of us that use iPhones. We've tried it. But iPhone is for rich people. So everything they will tell you to pay money, pay money, pay money. There was even an experiment I did in January in Kano, and I encouraged somebody to load it on Kobo Collect, and we were doing it and doing it. But when it came to submit the data, they said we should bring money. So I had to bring out my other phone and give the person. I know you have quickly enter everything you have done and submit with Android. So please, for the sake of this training, I would like each of us that have Android phones to bring out our Android phones. If you have an Android phone, please bring out your Android phone. If you do not have an Android phone, please move to somebody that has an Android phone. Just come close to somebody that has an Android phone. At the risk of exposing my many secrets, sorry, I don't remember my password anymore. Alright. At the risk of exposing my many secrets and my side chicks and my side ends and my side everything, I don't know if there's anybody I can loan this phone to. Alright? It's my only phone in this world now. So, please put your name, sir, in case you are looking for it. Alright, the app is already on the phone, so you will just follow the process All right, and the key, the passcode is my father's birthday. All right. Okay, so you downloaded the app. That's good. All right. Hello. Hello. I want us to follow, and I want you to be as participatory as possible. Rosarato Aliva, you've done this before, right? Please find somebody that you can support. All right. Rosajide, please sit down with a group so that you are not moving around. Sit down with a group. We need to do this very fast. All right. So it is available in the Google Play Store, and you download it from the Play Store. All right. Yes. So what you are looking for is ODK Collect. Just follow me. I will not. Don't rush. Follow me. What you are looking for is ODK Collect. Next slide, please. And there are so many ODK apps. All right. So you are looking for the one that looks like this. Can you see it? All right. So that's the one you download. The one that has that logo. Right. You see it on the Play Store. All right. Are we together? Once you've downloaded it, install it. I'm not smiling at us today because I'm a little bit disappointed. I was anxiously waiting for the year of my sister that she was going to be DRR because she was a member of NNPPC at some point. She has been with me from the beginning of this fight, and it was during the year of my sister, Fetia Aderoke as DRR, that we had zero participation among contractors in this district. She's 9112. She would have been friends 111 as well now. You see the same group of guys. I'm grossly disappointed. We had zero participation. Yeah? So please pay attention. So if you are smiling, I may embarrass you. Hello? So download it and install it. Have we done so? It's very simple. All right, so we move to the next thing. Next slide, please. Next slide, please. All right. So what you will see on your screen looks like this, right? You will see ODK collect data anywhere. Okay. Now it will show you. It will say scan a QR code or manually enter project details. I don't have that QR code, so you will enter the project details manually. The thing is this: when you download the app and you do not enter the project details, the settings on the app belong to the app. So what you will be seeing is app spot, and so all the forms, like I said, ODK is basically a questionnaire that you answer while you are supervising. So you need to download the questionnaire form, right? And if you do not get the correct server, you do not get the correct access, you will not be able to get that form, and you will not be able to send it to the server. So you need to change the settings. So you will now manually enter project details. Can we do that? Can we do that quickly? Manually enter project details. All right? So it will now show you add project. Can you see add project? So it will show you URL, username, and then password. URL, username, and password. Now, the URL is the address of the server, right? It's like when I call Bones and I say I'm going to Rotary Center. If I enter the address of the Rotary Center in Abuja, I will not get there. Are we together? So I have to enter number 8, Ladoke Akitola, so that it will bring me here. So you need to get the correct details. If you miss a single alphabet or stroke or dot, it will be the wrong address. Are we together? So it has to be the correct address. address. Now, the correct address is what you are seeing on the screen right now. Okay? I don't know how to make it bigger. Can you make it larger? Is it touch screen? Okay, so hello, can I call it for you? Okay, please pay attention. Hello, pay attention. HTTPS. HTTPS. Hypertext Transfer Protocol. Secure. The S is for secure. HTTPS. Okay. Then a full colon. A full colon. Not semicolon. Full colon. Right? Then after that full colon, you now have forward slash and forward slash. 2 forward slashes this way, right? Yeah, that's it. It's like this. It's this direction. 2 forward slash. Do you get it? Then after that, you will now get API. Have you got it? API dot, just one dot. API dot WHO NGHUB. WHO Nigeria NG HUB hub.org. Do you get it? WHO NG for Nigeria HUB hub, right? .org. Then forward slash again partners. Okay, forward slash again partners. So HTTPS colon forward slash API dot WHUNG.org forward slash partners. Your username partners. Your password partners. It's case sensitive, please. It's case sensitive, so everything should be in small letters. Username is partners, password is partners. Please make sure everything is correct. Right? So once you've got it, username and password as partners, you will now add it. So you've added your project. Okay? So next slide, please. Alright, so when you are done, you see, once you are done with that, right? Go to the next slide, please. Okay, now, there was an experience I had. One time I was in Ogbomoso, I was supervising immunization round, and I had, one moment please. So you got one of the details wrong. There was an I where it wasn't supposed to be. Alright, so let me continue this experience sharing. So I was in Ogbomoso and I was supervising a vaccination team. And when I was done supervising the vaccination team, I actually spent close to 45 minutes on this particular team, helping them to resolve non-compliance and everything. And then when I was done with this team, I now wanted to send my ODK to the server. And I found out I could not send it. It was not going. Then I got confused. What is happening? I'm used to this. I do this thing. I can do it with 2 hands. Sometimes when I'm in the field with my bosses, I go with 2 phones because my organ may not be able to do ODK by himself, and I'll be entering my own details and his own details together like this. So how come me that I'm an expert, a guru, this is not going? So I was worried. But fortunately for me, I had the number of somebody at NEOC, Dr. Aboyo of Affiliate, and I called him and said, "Bob, what is going on? This thing is not going." He said, sorry. They have updated the form this morning. So sometimes when you are in the field, you can update some details, maybe because of feedback from the field. So you may not have had that update on your phone, and then you have issues, and you won't know what to do. Eventually, I had to discard what I had done and start all over again. That means I couldn't enter that one for ODK. I had to take another thing again and start all over again. To prevent this situation where forms are being updated and you cannot update or you are not aware, just set the form to update itself automatically. Alright? So, because of updates, now you set it to update automatically. You see this button, if you have entered the details I gave you correctly, you will see this button at the top, right? So press this button. Press it now. When you press it, next slide please. When it will take this, can you see this form management? What's it saying? Okay, press settings, let me see. You did not enter the details correctly. Okay, can you see settings? Oh yeah, press settings. Can you see form management there? Do you see form management? Good. If you see form management, oh yeah, press form management. Alright. Nigerians, economy has made all of us freedom fighters. Somebody said, why is it that every day people are fighting inside plane? No be them, it's frustration. Everybody is feeling it. Hello? So, press form management. When you now press form management, what will you see? You will see blank form updates mode. Okay? So you will change that one to previously downloaded forms only. Can you see it? Change it to previously downloaded forms only. Hello? The next one is automatic update frequency. Change it to every 15 minutes. Right? Already on every 15 minutes. Good. Then automatic download. Right? So automatically download updated versions of forms. Can you see it? Yes. Do that as well. Then hide old forms. You need to tick it so that only the newest versions of forms. Hello. All right. So that is how to update your forms automatically. If you didn't change the first one, the other ones will not change. All right. So have we all done that? Mr. Ajide, please, I need you to walk the field. You did not change from manual to previously downloaded fonts. All right. That first one, change it from to previously downloaded fonts only. Okay? Yes, so everything is okay now. All right. So when we are done with that, so what it means now is that even when you are sleeping and they update the form, you will just get a notification that will show you that I've updated. You don't need to do it by yourself. It will just do automatically. Thank you. Next slide. Now, once you have done all of that, you are about to be ready. You are semi-ready. You have not reached final. You are still in semi-final. You now need a form, or 2 forms, or 3 forms, or 4 forms, depending on what you are doing in the field. Right? Someone like me, the way it is going, I may need up to 20 forms. That's where I collect my salary from. You know, I do this on a day-to-day, 9 to 5, 24 hours, 7 days a week. So when I'm not doing campaigns, I'm doing other things, right? So I can, on that list of forms, I may download up to 20 forms. But for you, in the southern part of Nigeria, you actually need only 1 form. I beg, the man is disturbing me. Please kill the call. So you need only 1 form. Now the form that you need, just press. You can see on your screen now. Can you see the interface? You will see download form. Okay, so press download form. Have you pressed it? Okay. You pressed it. Refresh. Press refresh. If it's not coming up, it's because of network. It's because of network. Press refresh again. Okay, good. All right. So, hello. What you will see on your screen is a list of forms. Those forms, they are your questionnaires for the different programs. Some of them measles, some of them rubella, some of them malaria, some of them Ibra, some of them plenty like that. You don't need all of them. You need only 1 form. Hello. As a Rotarian going out to supervise immunization on Saturday, Sunday, Monday, Tuesday, you need only 1 form. These forms have been arranged alphabetically. The problem is that many people will not notice that they have already selected all the forms for you. Did you notice? Yes. So if you go and get all, it will download all those 300 and something forms on your phone. So what you will do now, you will clear all. Can you see at the bottom, clear all? Alright? You've seen the clear all? You've seen the clear all, so press it. So what happened? Everything. Oh yeah, now, either you scroll or you search. Please give me the next slide, please. Clear all, you've cleared all. Okay, don't select all though.
Yes, select.
So you can see at the top of the button. So please, IPD's supportive supervision checklist. Can you see? So search for IPD's supportive supervision checklist. You have cleared all. Oh yeah, now look for this. Oh yeah, now inside that search, put IPD's supportive supervision. Have you seen it? Okay, now select only that IPD supportive supervision checklist. Only that IPD supportive supervision checklist. Select it. Have you done so? Yeah, you clicked it. So, yes. So now go under and get selected. Can you see get selected? So go and get selected. Hello, I'm not going to Abuja till tomorrow. So I will sit here. When we are done, those of you who have missed one step or the other, we'll go through it together. But let's do it so that all that roads is good. You are not ready to supervise. So on Saturday, when you step out and you meet the vaccination team, good morning. My name is Rotary Benga. I'm from Rotary Club of Ikeja. I belong to Rotary International, one of your senior sites. How far? What is going on? Any problems? Any challenges? You know you have already created rapport. And now you can be working with them, asking the questions as you are going along. That is the secret of ODK. From this point, observe. Whatever you observe, or you hear, you see, you smell, enter it into ODK, swipe left. Don't forget, observe, enter it, swipe left. Repeat after me. Observe, enter it, swipe left. Again. Observe, enter it, swipe left. Okay? So from this point on, we are good to go. Next slide, please. Go on. Okay. So when you now enter the field and you have met the team, what you will press? Can you see start new form? Can you see start new form? Press start new form. Okay. So from this point on, it is question and answer. It will just be asking you. It will just be asking you. You will be answering. But there are some areas that prove difficult for Rotarians. So I want to quickly explain what you should do when you have those difficulties. Next slide, please. Check. What is participation? Yada yada yada. Then it will now ask you what type of team are you supervising? Hello. The first question is you are the team. Do you want to supervise? Okay. You know our ASI was talking about super and that influence on youth. No. Usually there are at least 3 members. One of them is the team supervisor, who is also the recorder, right? You see the person down the person fronting, maybe AFP tag on the neck. The person, that's the first person. He will also carry a clear bag containing paper. Might be the person carrying the chalk also for wall marking. You will see them. So that's the first person. That is the team supervisor or recorder. Then there's another person who is carrying the vaccine carrier. When they come into your house to vaccinate children, that's the person that will open the vaccine carrier, take out the vaccine vial, and drop the 2 drops of the vaccine in the mouth of the child. That person is called a vaccinator, right? That person is called a vaccinator. Then there is a third fellow. That third fellow is supposed to be from that area. He's supposed to be a resident of that area. But because our system is flawed, everybody is doing things for their own interests. Most of the time it will be maybe okay? And some put the name and the child will not even show up. Okay? So when you meet a house-to-house team, you need to make sure that those 3 members are present. They can be more. In some states in the north, they may be up to 6. Because a VCM will follow them, independent supervisor will follow, another one will follow. But it must be at least 3 for them to be a house-to-house team. If you observe that team is not complete. Like I said, some of them will go and put their children that are under the age of 18. That is child labor. We do not support child labor in our program. The only thing we ask you, did you observe any of them that is underage? If you do, you will enter, right? Sometimes they will say, just go, when you come back, we'll give you transport money. Our program, we do not like that. We want to make sure that it's related to work. So before the program, we send them their money for logistics. It is not enough. It is not big money. In fact, some places they will tell you how much you send them. A little less one. So if you as a Rotarian, like me, my bosses have observed it, anywhere I go, whether they give me money in the office or they don't, I will use my money to motivate these things. Everywhere I go. Before it used to be 1,000 naira, because then Coke was 150. I used to get that. So if I give them 1,000 naira, the 3 of them, they can have a cold bottle of Coke on me. And I will tell them, this is courtesy Rotary International. So anytime they see Rotary, they're happy. But now, Coke is 500 naira per bottle. So if I give them 1,000, it does not work. Because like I said, there are 3 members. So now it has to be 2,000 or more. So you give each team. If I supervise 4 teams in a day, wherever I am on this continent, I give them 2,000 minimum. And if they impress me, I can give them more. Because there are teams that impress you. And there are things I have met. I said, no, I wanted to give you money before, I'm not giving you again. I've done it. I did it in Kwara the last round. When the team, I met the team. When I met them at 11 o'clock, they had done about 100 children. Then I left them, went to supervise another team. I came back at 12:30. I met them at the, how many children have you? They are supervised, they have vaccinated 450 children. How did you do it? How can it be? AI vaccination. How can it be? And then I'm asking, how many vaccine vials did you return? And I went to their vaccine vial and I saw 5 vials. They returned 5 vials, 4 that they had not used, and 1 that they could not use because the vaccine label had failed. That's another thing. If you observe that the vaccine label has failed and you cannot see what is written on it, they must not use that vaccine. Okay? Whether it's good or not, we don't care. Once the vaccine label has failed, you don't use it. So they had 5. Now, by my calculation, is 250 children they did not vaccinate. So how come they now had 450? So we had problems. So I told them, I'm not giving you any money, and I'm going to report you. We are going to blacklist you. Okay? So it happens. So I'm just giving us an experience. It is a very interesting experience. Those of you that don't come out, you are missing. You are missing. You enjoy it, and you will do it exercise. By the time I put in my steps, I look at my wristwatch, I've done 8,000 steps. Yes, now, I've done my exercise for the day. Hello? So it's easy. I'm encouraging you. Join us. See my sister there, Erotato Alima. This is, how many times have I met you in my life? Don't do like Pastor Bushiri now. Cover me up small. Hello. But we talk all the time. Anytime she's in the field, she will call me, hey, Doc, this is the challenge. This is what I'm going through. I will talk all the time. She's always in the field. Please give her a round of applause. She's one of my encouragement in this job. encourages me by her participation. I was in Ilorin, a Rotaractor from Sokoto. She has finished her education in Sokoto. She just came over. She called me, she said, Mr. Mega, I finished my education. I was a volunteer in Sokoto, but now I'm in Ilorin. Can I supervise? I said, if you supervise in Ilorin, nobody will pay you. She said, I don't mind. She said, I don't mind. I said, okay, come and meet me. And she met me, and I even sent her to a very difficult ward. And she was able to observe sharp practices where people were falsifying things, and she was able to observe and report it. And at the end of the day, I gave her money from my pocket. One of my colleagues that came from Abuja was also impressed with her. She also gave her money from her pocket. You understand what I'm saying? You don't need to wait for NMPPC to motivate you. Motivate yourself. Hello? So the questions will be asked, you will observe, you will enter it into the ODK, you will swipe left. Next slide, please. Now, there's something called get geo coordinates. We used to have it in the past that Rotarians will collect money from NMPPC. They will send them to Sokoto. When they get to Sokoto, they will go and lodge in the hotel. And then they will come back after 1 week and say, wow, Sokoto, only God, only. It was hard. How was it hard? The weather. You that you were inside this for the entire period, they are complaining about weather. So in order so that you know where you are, we introduce geo coordinates. Are we together? So on your phone, it will ask you for geo coordinates. When you press get geo coordinates, right? You can see it on your phone, right? So when you press get geo coordinates, it will be scanning the satellites, looking for your position. So it will come out with your longitude, latitude, and altitude. Show us where you are on this earth, so that we can know where you are. But there's a challenge. Sometimes, because of concrete decking like this, sometimes maybe because of cloud cover, sometimes maybe because there's a heavy canopy over your head, like a real big tree, you will find it difficult to get that desired accuracy. So you can look at this now. You will see 1,600 meters. That accuracy is too large. Hello? How many meters make 1 kilometer? 1,000, right? So if my accuracy is 1,600, what does it mean? It means that when you are trying to locate me, you can look for me 1.6 kilometers this way, 1.6 kilometers this way, 1.6 kilometers this way, 1.6 kilometers this way. You will never find me because that area is too large. So you have to wait until the accuracy is under 10 meters. Hello? So if you've done it and it is not going to under 10 meters, just change your location. Leave where you are. Maybe like we're inside this house now. The concrete is preventing you from connecting with satellite. Just step outside and do it again. And you will see that the location will come under 10 meters. Okay? That's great. So you see that. So once you do that, swipe next and continue answering the question. Now, it's important. Which agency are you representing? Can anybody tell us? Which agency are you representing? Which agency are you representing? Please don't go there and feel government. Hello? I know what I'm saying. We look at the data. The data I saw for Rotary last round, there were 3 or 4 names inside that entry that I don't know as Rotarians. For instance, I did not know anybody from Rotary who went to Yobe State to supervise. But because that person too was confused, did not know the meaning of agency and just told something. So please, inside money, outside. Put it for Rotary. Which agency do you represent? Rotary. Which agency do you represent? filling your name, hello, please listen to me. When it comes to filling your name, please, because it is your phone, once you start to type your name, auto suggestion will come out, right? Immediately I put in, that's why I use that example. You can see Benga, Ola, you see that it has brought out Olayewole, that's my surname, and immediately you accept it. What actually happens is this: when I press Benga, it will bring out Benga. When I accept it, it will put space, so it will be Benga space. When I start to write my surname, Ola, it brings out Olayewole, I accept it, it will bring out, it will now become Benga space, Olayewole space, right? It is Benga space, Olayewole space. Now that space behind Olayewole will not allow you to go forward. Okay, so you need to delete that space. So if you are using auto suggestion, immediately you accept your surname or the other name, delete the space behind it so that you can go forward. All right, are we clear on that? Next slide, please. Okay, then there are stages of vaccine. The acceptable vaccine stages are stage 1 and 2. Once the vaccine goes to stage 3 and stage 4, it is no longer potent, it's no longer useful for our children. So anything you see in the field with vaccine in stage 3 or 4, those vaccines must be removed from use immediately. So only vaccines in stage 1 and 2 are acceptable. Now there's a question that says, this vaccine, is it in stage 1 or is it in stage 2? Are we together? It will ask you, is it in stage 1 or stage 2? I think the question is question what? Question 19. The question is question 19. It will ask you what stage of vaccine it is. Hello, please, if you are not sure, ask somebody. Are you together? There will be other people, WHO, UNICEF in the field. If you are not sure of the stage of the vaccine, ask somebody. Because if you select stage 3 or stage 4, somebody will flag it and they will call you. They will call you, they will say, Rotarian, please, we are using vaccine in stage 3. And then if you have made a mistake, it becomes embarrassing. Because now you say, Rotarian, they don't even give them any training. Just send them into the field like that. Hello? So for clarity, unfortunately we don't have the vaccine vial here. If you are not sure that the vaccine is in stage 3 or stage 4, please do not enter it. Hello, ma'am? Yes, it's on the vaccine vial. There's a vaccine vial monitor with stages of the vaccine. Stage 1, the white inside that, the white square inside that circle will be very white. If it is not so white anymore, just a little bit more, it's stage 2. If it becomes the same color, the square and the circle is the same color, that's stage 3. Now, if the square is darker than the circle, that's stage 4. So, once it becomes the same color or it becomes darker than the circle, the vaccine can no longer be used. Are we together? All right. Next slide, please. We are coming to the end. All right. Now, it will ask you, what type of campaign is this? Is it a national immunization plus this, like we had in May? Is it an outbreak response? Whatever it is, NMPPC will let you know. If it's an OPR, we'll let you know. If it's an NIPD, we'll let you know. If it's an SNID, we'll let you know. Okay? So please, just fill in the correct one. Also, the vaccine that we are using for this round, it will also be stated. Is it BOPV or MOPV? For our campaigns, the vaccine we use these days is called MOP2 for most of our campaigns. But sometimes we have campaigns where we use BOPV. BOPV is mostly used for routine immunization in Nigeria today. But because of outbreaks, like we recently had the case of type 3 virus, that's to show you we have a big problem in Nigeria. Our immunity level is nowhere, right? Type 3 virus was found in Yobe State. So we had to go to Yobe State and do what we call co-administration. And we administered BOPV and LOPV together. So we administered both BOPV and LOPV together. And we did that in Yobe, Jigawa, and some other states. Alright? So for the most part, the vaccine we use is called NOPV2. Novel Oral Polio Vaccine Type 2. Novel Oral Polio Vaccine Type 2. NOPV2. That's the vaccine we use for our family. Next slide. Okay, so please, once you are, like I said, fellow retailers, like I said, it's a questionnaire. You have answered all the questions to the best of your ability to, based on your observation. Observe it, enter it, again, So I got into trouble because of that. That is, enter it, observe it. There are about 40 something questions in the questionnaire. So within that period, 15 minutes, you are talking to the team, you are working with the team, you are building the team, you are laughing with the team, you are making new friends. When you are done, you need to send your data, right? So you need to mark it as finalized, right? So when you get to the end, you ask you, is it finalized? So mark it as finalized. And once you mark it as finalized, it means that you cannot change anything, right? Then thereafter, go back to the beginning and then send your data. Please make sure that you send this data before 2 p.m. every day. Hello? It's very important to please make sure that you send this data before 2 p.m. every day. There's a reason for it. Data collection takes place from 2 p.m. And if your ODK entry is not on the at 2 p.m., they won't get your entry. It will not be reported for you. So please, whatever you do, make sure that you send it before 2 p.m. every day when you are in the field. Also, some of us, we don't want them to know where we are. So we permanently keep our phone location off. We don't want to be traced. But I assure you, if government wants to find you, they know where to find you. So please, when you are going to the field for ODK, please set your location on because you need it to collect your data. Also, when you are in the field collecting data, doing all the data that you are you need internet data to supervise. Kindly make sure that you have some internet data on your phone. Okay? Just make sure you have some data on your phone so that when you finish, you can send. Remember, send it before what time? Before what time? Before what time? Thank you very much. And so once you send it, it will be recorded against your name. If you open your file, open the file that you have in front of you. There's a piece of paper there, right? That is your ODK data. You can see the name of the person that committed the offense inside that sheet, right? Please can you read 2 of the names of those who went out to supervise in June? Just read out 2 of the names.
AP Kibina Warikoru.
In which state?
Bayelsa.
Data does not lie. Does data lie? What about Lagos? Where are Lagos there? Yes. Who went out in Lagos?
Wait, sorry. Adenike Abdulaziz.
Adenike Abdulaziz, she here? She has gone. Okay. Any other person?
Akinjeje Rosemary.
Who is Akinjeje Rosemary? Ikorodu. Okay.
Bolaji Barakat.
Boraji Barakat, and who else? Please give him a round of applause. And Tunji Funsho. What is interesting about Tunji Funsho is that he just came back from Rotary Convention and he still came out to supervise. So they said if you prioritize it, you will find a way. If it's a priority to you, you will find a way. If it is not, you will find an excuse. So when we are going out to supervise and you find yourself making excuses, ask yourself, is polio eradication truly a priority to me? Are you getting me? Is it a priority to me? Look at Kwame. That thing inside that bottle was a priority to him. So he kept on finding a way for it. Right? Are you getting it? So please, let polio eradication, let polio supervision be your own, that thing inside the golden flask. Thank you very much.
Let us please appreciate our National Field Coordinator. He's been the backbone of us. I remember when I went to Sokoto, it was a very interesting experience. You need to be on the field to understand what it's like. Yes, we are having only being installed on our phone, but then it's good when you are working with the team and then you see how it's being used, then you enjoy it. Once again, let's give it to you again. Thank you so much. Now we got ODK, and look, what that was important, I never even know that my name is on the file. So you see, he said we must post our program by 2 o'clock. If I had not posted those things by 2 o'clock, it will not be captured. You see, when we start the work, we might need, the only time we need our data is when we want to send. Filling the form, we don't need the data. But we could just, some people might say, okay, let me conserve all these things, and when I finish, I will send. We might forget, anything might happen. So please, immediately you finish with the team, send it. Immediately you finish with the team, send it. I'm sure when next the ODK, the next grant is coming up, people to have probably training for ourselves, and then we still update us. And like I said earlier, the District PolioPlus Committee Chairman is here. I am here. Every member of the District PolioPlus Committee, we are all resources for ODK and then for polio organization. Please let us all identify ourselves with one PAC. We need to identify ourselves in the primary health center. When we are giving out pluses is this sweets and biscuits. The last time we gave out Indomie, and now you know how much an Indomie costs. The April round at mile 12 with the National Vice Chairman, we had to look at some peanuts before we could say Jack. We went into an Arabic school and these children swarmed us. Before we gave out those peanuts, they were not interested enough. But the moment they saw the process, it attracts them. I have a bag now, my polio bag. When you take the bag, you see sweet, you see biscuits, you see all those things there. I always give it to them. When there's no round, I call the children in my community, then you come take. So please, let us encourage this habit of having pluses. We don't need to give to 10 IDS centers. Well, this is the privileged information. We have a former local organization among us, that was the president of the Rotary Club. She knows that they always have pluses in that and pluses in that. But in those cases, clubs want to give it directly. And then that's why we see Rotarians doing paparazzi, taking pictures with it. So, fellow Rotarians, we want to appreciate you everybody for having come this far. So, we want to call on the National Vice Chairman to please give us the closing remarks.
In this governor, my chair, PDP Joshua Azan, who sponsored this seminar. Thank you, sir, for this seminar. The job of thanking everybody, I'm sure, is that of the committee secretary. But I want to particularly observe the patience of all our Rotarians here present. Please give yourself a round of applause. Give yourself a round of applause. You have done very well. Because when you look at the time, it's 3:17. Usually when we have programs like this, by 2, everybody will have gone. So we'll be in a hurry to end the program. So the DPPC, thank you very much for your organizational ability and for making sure that everybody participated actively. I just want to add the issue of World Polio Day. And I want to plead with the DPPC and the team to ensure that District 9111 comes first with activities with reference to World Polio Day. Our chairman showed us that Brazil came first, US came second. There was a time about 4 or 5 years ago, Nigeria came second. So this year, with this kind of enthusiasm, I'm sure Nigeria will come first. Any meeting, the ordinary meeting that we hold, is an activity towards the World Polio Day. And I want to encourage the DPPC and the team to ensure that of all districts in 911, in Nigeria, the 6. In terms of iterations, District 9111 comes first. Is that a promise? Says she has already confirmed that all activities, everything you do towards Polio Day must be registered for us to come first. The other issue is that all clubs must have a PolioPlus committee. How many clubs do you have here? How many? Unit number of clubs? No, here. About 20 clubs, more than that. Okay, so we want every club to have a PolioPlus committee with a chairman, a secretary, and a member. At least 3 members of the PolioPlus committee. And we want those committees to ensure that you link with the local government near you by registering with them and making sure that you are available for pre, post, and during the immunization days. And now we have NIDs, sub-NIDs, OBRs, and IBR, which we are starting in October. Next week, IBR means in between ranks. We are starting that in the AIT states. But when you register your club with a local government, then you can go there and visit. And I'm very happy that the SIO has really acknowledged the control of goods. I want to thank government for allowing us to come into your space, because you always tell us to go away. But we thank you for allowing us into your space. And through you, we want you to help us thank the state government for all you do to ensure that polio eradication is given a top priority. The other issue I want to, when we discuss OBR, field activities, and then during the presentation of WHO, he stressed that the GPI has extended our transmission ending and stopping transmission to 2029. And you can make sure that you can do this before 2029 by putting all hands on deck and not looking back. Thank you very much.
Thank you very much, sir. Now, before we call it a day, I would like the following lieutenant to step forward. ADPC Taiwo, step forward. Sorry, Kayode. And the president regional of Akko, please step forward. Rotarian David Wright, step forward. Mrs. Balogo, oh, she has left. Sir, I would like you to help me present the expo to the Rotarian Mrs. Taiwo and the president. They were here as early before 10. Yes, we were here before 10 this morning. And right. Thank you so much for your God bless. Yeah, Taiwo now, Toyin. Yes, yeah, I'll give you. Please step forward to Toyin. I thought Rotarian Adetolike, please step forward. And of course, Rotarian Temidayo of the committee. So thank you very much. DG is here.
So
Rotarians, my distinguished leader, the chairman, sir, vice chair, representative from Esther, UNICEF. Yes, I want to say a very big thank you, for being part till the end. Sincerely appreciate this. I want to thank you very much. Wow, can we put our hands together to the latest donor to our foundation? $100. Thank you so much. Thank you so much. Thank you so much. Oh, fantastic. Maybe she's going to be the winner of this. Thank you very much, my fellow Rotarians, media officers, and polio staff, and all my United presidents. It's been a wonderful day. I mean, I know for sure that we have all been exposed to all we need to know about polio. And like I said in several of my presentations, please, we are going to call on everybody. We are all going to be out there during immunization. All of us, we are going to be out there to support immunizers. Every club is meant to adopt a primary care center. So please let us know. Register your primary health care center at the district so that we can also support you when we want to have immunization. On that note, I want to say a very big thank you. I look forward to a very fulfilling year, and I wish you safe journey back to your respective destinations. I want to say a very big thank you, and I thank that God bless you. The paper that has just been passed around, this police and said that somebody must go away with and she has just said that the highest donor at this seminar will go away. No matter how any amount, $10, $20, $30, $50, $100, whatever you have, just write it as a pledge to be redeemed before the end of the month, and you have this beautiful check from Eversting go with you. So I thank you. I give you 2 minutes for that. The winner will have the opportunity to have these being presented by our NMPPC chair. And don't be surprised, this will go into the publications of NMPPC, either into the magazine or calendar for the year. So I think you would love to be the winner so that you can have your picture displayed even on our own platform as a district. Thank you very much. Please give the paper back to the committee and let us please announce the winner. Thank you very much. You need a pen, man. You need a pen? Thank you. Do you need a pen?
I've made use of my pen.
Whatever you donate, whatever you give will go to your own account. Whatever you give will go to your account in recognition of your contribution. So it is for you. Can we have it at the Tony please? DPC, can we have? Can we announce the winner, please?
1 second, Chief. You want to increase excuse me, 100%.
I don't think you were waiting.
Now we have the winner. Please may I give you. Can we announce the winner? Can we announce the winner? And the winner is Romelia Oluwole Ore from Authority. Can we put our hands together? Yes, he has made a donation of $120, even cash. Wow. Straight contribution. So can we please put our hands together for her, please? May I invite our chairman to please help us to present this to the highest donor to polio fund today. Thank you very much. Please, shall we rise for the national anthem? Okay, vote of thanks. Vote of thanks, secretary. Then we take the national prayer.
Good afternoon once again. Standing on existing protocol, on behalf of the District PolioPlus Committee, sense of today's polio seminar. Our heartfelt gratitude also goes to our District Governor Rotary Prince Henry Akinyele for his leadership and unwavering support, to the DRR for honoring us with his presence, the Chairman and the Vice Chairman of NMPPC, thank you very much for your various contributions, And also would like to appreciate our national coordinator for the guidance so generously provided. Thank you very much, sir. We are equally grateful to our development partners, the UNICEF representative, SIO representative, and the WHO representatives for their continued collaboration in the fight against polio. And to the DPPC committee members and all fellow Rotarians, thank you very much for your dedication, active participation, and unwavering commitment to this noble cause. Your presence here today is a testament to our shared determination to achieve a polio-free world. Together, we are making history. I wish everyone journey mercies as we return to our various destinations. Thank you very much.
Please let us rise for the national anthem, please. After the count of 3, 1, 2, 3.
Bye.